All right, hopefully everybody can see that and hear me.
Yep.
Yes? Yes?
Yes.
Okay.
Yes.
Yes, very good.
Great. So good morning, everyone. We're going to spend about the next 45 minutes or so going through just a really broad overview of life in nursing school. And as Amy mentioned, there's so much information thrown at you in orientation. So I'm trying to just get you the big takeaway points for your program. And once you kind of get through your summer semester, you'll get a little bit more in the rhythm of the program. And you'll have your classmates and your peer mentors and your faculty to lean in. We're going to walk you through it every step of the way. And I think probably the biggest mantra in your head as you move through the program is to trust the process. We have collectively hundreds of years of experience amongst the faculty and leadership team. And so we will do our very best to walk you through this with as little stress as possible, because nursing school is stressful enough just in and of itself. So just to get you started, your program of study, which you all should have received, is planned for the entire 2 years that you will be here. And so that program plan is what you need to tape onto your refrigerator door so that you can start checking off those classes as you move through the program. So you don't need to worry about, you know, do I need to figure out what's going to happen next semester? Do I need to get up at, you know, midnight so I can register for that course that I need? All of it is planned for you. We're all expecting you in those classes. We've reserved spots for you. So your entire program has been planned out for you for those 2 years. Courses are available only during very specific times of the year. So for example, your summer and your fall courses are only offered one time in the year. And so again, very specific program plan. There's no, hey, can I take this, you know, this course here and that course there? I want to change up my program plan to fit my schedule or my work schedule. Essentially, it's all planned for you, and the courses build on each other. So one course builds on the next, on the next, on the next, and they're sequenced in a very specific way to allow for maximum development of you in your nursing journey. Some courses, just like we talked about just a minute ago, people asked about the semesters and the blocks. Some courses occur over the entire semester and others in what's called blocks of weeks. And so when we talk about blocks, typically a block is 8 weeks. So if you divide that semester in half, typically you will have a block 1 course for 8 weeks and then a block 2 course for the next 8 weeks. That can vary a little bit with a week on either side, but when we talk about blocks, typically we're talking about an 8-week block of time. And then a semester, of course, is your traditional 16 weeks. Fall and summer semesters are very heavy didactic content, very heavy didactic, very heavy on-site or on-campus clinical time in the Clinical Education Center. You will have some off-site or off-campus clinical time. Again, depending on the COVID-19 landscape and the campus landscape, that's still a little bit in flux. I will say very proudly that throughout the whole COVID pandemic that we were able to, because of our strong clinical partnerships and really because of our students who are fabulous and awesome, we were able to pretty much maintain our clinical hours to some degree. Most of the students, if they didn't get their full clinical time, they at least got half of their clinical time. Some of our students in our accelerated program, we were only able to do, for example, simulation time because of the compressed nature of their program. But pretty much, we are pretty much back to normal in terms of clinical hours and clinical time. And again, that could change sometime. We have, and I'll talk about that in a minute about the clinical piece, but pretty much we're back on target and back in full capacity for that. So again, and if you talk to any student who is a senior, a peer or the peer mentor, they will, I think, agree Your summer and your fall is the busiest, most compressed time in terms of knowledge and gaining knowledge through those really foundational courses. Pathophysiology, very dense course in the summer. Fall, pharmacology, very dense course. MedSurg 1, very dense course. So you're going to have a really busy summer and fall time with us. And then after the summer and the fall, and I will say the summer and the fall, everybody has the same courses. So everyone in the summer is going to take patho and health assessment and your roles course. Everybody in the fall is going to take foundations, older adult, pharmacology, and MedSurg 1. Then when we get to the spring, so spring of 2022, that's when we're going to divide your color groups up. And that's where you're going to look at and follow your program plan. So you may have a classmate in the spring taking complex care in block 1 and mental health in block 2, but you're taking OB in block 1 and peds in block 2. So that's where everybody kind of gets split into their color groups, and you're going to follow your program plan. Your last semester with us, and again, this is just the big, broad 30,000 foot view. So once you get through the summer and the fall with those basic foundational courses, essentially the rest of your time with us is going to be knocking off those remaining clinical courses. So you're gonna take OB, you're gonna take peds, you're gonna take complex care, which is MedSurg 2. You're gonna be taking mental health. When you get to your last semester with us, you'll have 2 pretty big clinical courses called Immersion or Capstone. So Immersion in block 1, and then you're going to have Public Health in block 2. So your last semester is kind of this big bolus of clinical hours. Your last semester with us, the didactic portion of those courses is completely online, and that was pre-COVID. So your last semester with us is completely online for the didactic because there's so many clinical hours. It allows you to, it frees up your schedule, if you will, to get those clinical hours in. So again, big 30,000 foot overview is, again, summer and fall, heavy foundational courses. Everybody takes the same courses. Spring, starting spring 2022 through the remainder of your program, is going to be heavy clinical courses. That's when you're going to, again, do those OB, peds, mental health, complex care. Your last semester with us is going to be your immersion course and your community health course. Your last semester, the didactic, is completely online, okay? So didactic content delivery, you're going to hear the word synchronous or asynchronous associated with how didactic content is delivered. Synchronous means the class meets a specific date and time. So students will be expected to be in class this remote semester. You will hear the term synchronous and asynchronous. For synchronous, students are expected to be in class just as you would face-to-face class. So for health assessment has synchronous class times, which means the blue group, for example, is going to meet at a certain time on Mondays. The purple group is going to meet at a certain time on Mondays. You're expected to be in class during those synchronous times, just as you would a face-to-face class. Asynchronous means the class is completed according to a schedule defined by the faculty. So you may have some specific times that you're required to participate, like in an online discussion or meet with your faculty. But again, asynchronous typically means that you're going to go through that course, doing those modules or doing that classwork or posting discussions or whatever it is at your own time, in your own time. But you may have some part of that class where you have to meet. Like every other week, we're going to meet on Wednesdays from 3 to 5 to do presentations or whatever the case may be. So that's the terms you're going to hear as synchronous and asynchronous. And again, it will be clearly defined in your syllabus, what times you need to meet and what days you need to meet. This is an overall picture of your clinical courses in terms of your clinical time. So on-site clinical hours, again, means that, on campus, clinical education center time. Realize for health assessment this summer, that's all going to be remote. But when we're back in person in the fall, on-site clinical time means you're going to come to campus in the Clinical Education Center and have time there. Off-site clinical hours means off campus. That's your direct patient care hours. And then total clinical hours for that course. So for example, health assessment this summer, you're going to have 33 on-site clinical hours. You're going to have one 12-hour shift at University of Colorado Hospital for a total of 45 clinical hours for health assessment. Every single course is listed there for you in terms of the on-site time, the off-site time, and the total clinical hours. So the bolded courses are kind of your big, if you will, clinical courses: Med-Surg 1, OB Peds, mental health, complex care, immersion, community population nursing. So those are kind of those big, again, clinical courses that you're going to start checking off your list starting in spring of 2022. So you can see the total clinical hours for on-site in our program, the total off-site clinical hours, the total clinical hours in our program. Now, why are these clinical hours so important that we count all of them? Is because our State Board of Nursing requires a certain number of clinical hours, 750 clinical hours for nursing programs for students to complete in order for that program to be sanctioned by the State Board of Nursing, and in order for us to meet requirements that our State Board of Nursing has for our nursing programs in order for you to be licensed. So that's why all of the clinical hours we keep very close track of, so that we're meeting that State Board of Nursing requirement in order to get your license. So you'll see that as you move through the program, heavy on-site clinical hours and health assessment and foundations. Med-Surg 1, again, that's going to be your summer and your fall. Time heavy on-site, you're getting those foundational skills. And then as you keep moving through the program, you're going to notice that the needle tips a little bit more to heavier off-site clinical hours. So again, starting you out in that lab, developing foundational skills, how to do a physical exam. Foundations, you're going to talk about how to give medications, how to start IVs, how to give injections, those nursing skills. And then you'll see as you move through the program, there's more off-site clinical hours. In other words, that's when we're starting to put you in those direct patient care situations so that you can start developing your nursing practice. So that again is the big clinical course overview. So I'm going to pause right there and see if people have questions. Amy, is there anything that I can answer in the chat?
Yes, let me scroll up there. So one student asks if all of the offsite clinicals will be at UCH, or will they be in other hospitals too?
You will have clinicals in other hospitals too, yes.
And then they also asked if they could have a copy of this PowerPoint for reference later.
Sure, absolutely.
Okay. And then there was a question about the nursing research class, the Nursing 3080. And a student asked if that next summer, if that was going to be online.
Yes, that's correct.
I think that's all the questions.
Oh,
so far.
Excellent. So far. Great. And I know you got a lot answered before I even started, and we got some answered too last week. So that's awesome.
Okay, wait a minute. There was two more that popped up as I was just saying. Sure. There was no more questions. So, so one student was asking, will there be a supply list for what we can bring to clinicals?
Yes, when you start your clinical, they will tell you in your syllabus, that specific course, what you need to bring. And typically it's, your stethoscope, pen, a pen light, some people bring scissors to keep with them. So you'll figure that out real quick, like either in your syllabus, or when you're starting that clinical time with direct patient care hours, you're going to have an orientation time. So during that orientation time, before you even start those clinical hours, they're going to go through equipment, what's required, what you can and can't do in that agency, the flow of the day, what your clinical instructor expects you to bring in terms of, you know, do you need to bring a med book? Do you need to bring your med surge book? They're going to go through all of that with you. So you don't need to worry about that. That'll all be in your orientation for clinical.
And then a couple more questions.
Yeah.
Will we have an option where our immersion clinical hours will be?
Right now, we ask students for their preferences. So we will have a system in which students will be able to fill out a form that gives their preference for a specific patient population and or a specific hospital or organization. So yes, that is still available for our immersion course.
Okay, and I think that covers the next question as well about a specialty interest, so I'll keep going on.
Yep.
And then go ahead.
No, I was just going to say, please note the word preference. It doesn't necessarily mean that we're going to be able to match you with that preference. Many times we get a lot of preferences for immersion in specialty areas such as critical care, ED, OB, PEDS, NICU, etc. And there are very few immersion placements for those specialty areas. Some facilities require somewhat of an interview process for those areas. So again, we do our best. The majority of the immersion placements will be in medical surgical areas, just because that's where the biggest patient population is.
Got it. The next question was about if students will have any sort of NCLEX prep materials while they're in the program.
Every single test that you take in the program is based on an NCLEX format. So every single test is an NCLEX type question. Every single answer is an NCLEX type response. And just know that we are actually, the National Councils of State Boards of Nursing, which is who writes your NCLEX, is going through some pretty transformational changes right now that you may experience in 2023 when you take your NCLEX. So the faculty is busy preparing students for getting ready for a sort of a new type, if you will, of NCLEX exam that is really more about critical thinking than it ever has been before. So yeah, just know that you're going to go through this program and you're going to get preparation with every single class that you take.
So one student asked about the specific program plan. So your plan of study was emailed to you from Dan Hussey. So you're not going to be able to find it anywhere else. So if for some reason you can't find the email that he sent, and that email is very important because it has your plan of study as well as your color group, so that you know how to navigate the orientation sessions this week as well. So just reach out to me or reach out to Dan Hussey, even better, if you need another copy sent. Okay, I'm gonna try to get through that. There's like 10 more questions now, so they're piling up. Do you want to take a pause on the questions, Dr. Spencer? Or?
No, if this is a good time, I'm fine.
Okay. So we have a student asking, when can students expect the syllabi to be sent out for summer courses? And I would imagine that means, when will the Canvas shells be open?
Yep.
In other words.
Yep. And so my Canvas shell for health assessment is oh so close to being open. So I would say in the next 24 hours, I will open it up for health assessment, and it will have the syllabus posted. It'll have the first week or two PowerPoint slides posted, etc. So yes, it will be, my health assessment course will be up very soon. Patho, I would think, is going to be up this week. So very soon as well as your ROLS course.
So what if something comes up and a student cannot attend a clinical on a date that you're assigned? Is there a possibility to reschedule it?
Mm-hmm. That all depends on the clinical and the clinical agency. So sometimes we are able to reschedule it. Again, it depends on our contract with that agency and our contract with that clinical instructor. So sometimes we are able to reschedule that missed date. Sometimes we're not, and if we're not, typically we lean into and assign a student a simulation. So a virtual simulation exercise that can be done in lieu of that clinical time.
Okay, the next question is about clinical groups. So the student is asking, Do our clinical groups have anything to do with our color groups? And will we know our clinical groups once we get the clinical schedules?
So that will all, the experiential learning team will go over all of that with their orientation time with you.
Okay, next question about clinicals. Are there clinicals scheduled during the August break this summer?
Currently, right now, there are not any clinicals scheduled during the August break. Realize that any break that you have, the traditional break between semesters, we can schedule clinical time, and that just depends on the clinical agency. Sometimes, I'll just give you an example. Sometimes we have an instructor for a clinical and that instructor gets sick or something happens. They're not able to do that clinical as planned. And so therefore we have to push that clinical out later. And sometimes the out later time is during the break between semesters. We try really hard not to do that because we know that you all need a break from nursing school. And that's when you schedule your time off or you schedule more hours to pick up for your own employment purposes. So at this time, I don't anticipate for the incoming junior students to have clinicals during the August break. But I can never guarantee that. But at this point in time, I think the chances are very small that you will have any kind of clinical in August.
Okay, so the next question is there a possibility of taking any elective classes like language classes?
Is there a possibility that you can take an elective class?
Right, like
You
such
mean,
as a language class.
I mean, you can take an elective class such as a language class. You're just going to have to work around your clinical and your class and your study schedule. So, you know, everybody's a little bit different in terms of how much time and effort they put forth in their classes. Just depends on your own learning style and your own learning needs and how you absorb the material. So we just have to work around your class and clinical schedule.
And I would also add to that, we don't offer any of those classes at Anschutz, so it gets a little bit tricky, even though there's this parent organization that kind of, you know, includes all of the CU campuses. There is a little bit of finessing that has to happen behind the scenes if a student is trying to cross enroll at another CU campus. That's something that we can discuss kind of offline, but just know that it's not as easy as going in and registering for a CU Denver downtown class. There are some things that have to be updated in the system. So the questions keep on coming, Dr. Spencer. So if you want to stop at some point, let me know. There's a student that asks, will there be an option to continue virtual learning in the fall? Example for at-risk students and families and students unvaccinated children.
Yeah, and I don't have an answer to that. I think that everybody's looking forward to the fall to see how that's going to unfold. So more to come on that. And we've heard from students, you know, is there going to be another plan for a remote option, both from our juniors and our seniors? So more to come on that.
Yeah, a couple students just commented, thank you, that the nursing roles class is already open in Canvas.
Mm-hmm.
And then the next question is about, is there tailored support and advising resources for post-grad paths, i.e. what things to focus on or get started on now if we wanted to go into, let's say, CRNA or NP programs?
Mm-hmm. Probably my best advice for that would be to contact myself in terms of graduate program options and how to best position yourself. When you get closer to your senior year and your last semester with us, we will have a pretty in-depth, robust advising session on how to get ready for the new grad world, how to apply, interviews, what to expect. We invite our clinical partner, new graduate residency coordinator, program coordinators to help you position yourself best in this very tight competitive market right now for nursing. So yes, if you're interested in graduate programs, I'm happy to point you in the right direction as you move through the program.
Okay, I think we're caught up with the chat, so I'll let you proceed with your presentation,
Awesome.
Dr. Spencer.
These are they're great questions, and
Yeah,
I know there's so many things running through your head right now, and it feels very, very overwhelming. And again, take it one day at a time, one step at a time. And if you have questions along the way, we're certainly happy to help you. Amy, myself, your course faculty, your peer mentors, we're all here to answer them. There's never a stupid question. Okay, so what to happen if you have an interruption in your program? So something unexpected occurs in your life. You have an illness, you break your leg, you have to have surgery for appendicitis, you have a family crisis. There's something that you were not planning on happening during the nursing program. And I know most of the people sitting in the audience right now think that's not going to happen to me. But sometimes it does happen, and we've had it happen to nursing students along the way. So I just want to kind of cover some of those what ifs in your nursing program. And basically what I want you to hear loudest is each situation is considered on a case-by-case basis. And so resolution and progression in the program is really determined by a team of people in conjunction with course faculty, myself, the undergraduate program office, the experiential learning team who looks at your clinical placements. So progression is really dependent on where this event occurs in your program, what course it occurs in, and what it would really look like in terms of you being able to progress. So it may be that this unexpected life event will require you to withdraw from your courses and be placed on an individual program plan. Students also have the option for a leave of absence if it's determined that the student needs to take time away from the program. So again, it really is so individual. I can't say with a blanket statement, hey, if you have to have surgery, it's not going to interrupt your program. I just can't say that because it really depends on what the surgery looks like, where you are in your program. Have you finished up all of your clinical time, for example, in your OB course, and you have to have some minor surgery that's, you know, a week that you're going to be perhaps out, we can probably work around that. If you go skiing and you've fallen and broken your leg and it's going to take a 6-week recovery time and you have to be on crutches that whole time, that's probably a conversation of we're going to have to interrupt your program and look at an individual program plan and see what that's going to look like in terms of delaying your graduation. So just know that if you have those unexpected life events, we want you to be in this program as much as you want to be in this program. And we understand that the longer you're away from the program for these unexpected life events, the harder it is to be away from the program. And so again, we're going to work really hard to try to figure out a way for that life event to have as little impact as possible on you and on your progression. Because again, we want you to be here, we want you to progress and get out there and be a nurse. So the biggest thing again is if you have a life event, let your course faculty know, even if you're not sure that it would really even play a role in your progression. Just say, hey, I've got this coming up. I don't think it's going to, be a big deal, but I just want to let somebody know so that we can plan accordingly, so that we don't have any surprises and you don't have any surprises in terms of you progressing in the program. The other piece is I want you to hear, if you need to take a leave of absence for whatever reason, I always want students to know that if you're in a situation that you feel like you need to take some time off, please contact me and we will figure out or look at what that's going to look like. Even if it's, I'm thinking about doing this, here's the situation, what would that look like? Please contact me and we'll go through that situation and say, okay, here's what it would look like if you took a block off. Here's what it would look like if you took a semester off. Here's what it would look like if you took a year leave of absence. So all of those things we can sit down and look at and say, this is what's going to mean for your program, so that you have that information if you're thinking about a leave of absence. I never want students to feel like they don't have options in situations like that. You do have options, and we just need to sit down and figure out what it's going to look like for your program. If you have an interruption in your program due to a course failure, our College of Nursing policy states students can repeat 1 failed course. 2 failed courses at any time during the program will result in a withdrawal from the program. If you fail a course, you'll be placed on probation, and then depending on when the course failure occurs, you may be placed on, again, that individual program plan. And those courses on our space available basis, like we mentioned before, some courses are only offered once a year. So if there's a course failure, for example, in one of your courses in the summer or the fall, you may have to wait a year before you can take that course again, because that's the only time that it's offered. So again, we'll have a conversation about what you can work on to be successful, some things that perhaps you know, need a further conversation with our campus resources, for example. And so we'll have that conversation and see what you need so that we can support you to be successful in the program. And so that's, again, we're here to support you. We're here to provide you with those resources. Please use the resources that you have available this summer. You have tutoring TAs, you have a student success specialist, you have peer mentors, you have your course faculty. Use them early, use them often, because that's really the best way that you're going to be supported throughout the program. Clinical documentations, and again, the experiential learning team will talk to you about the clinical compliance and the clinical documentations. The biggest takeaway point from this is please pay attention to your email. Check it every day, because that's where an email is going to come to say, hey, this is our next deadline for clinical compliance documents. You need to get your clinical compliance document by this date. Those documents and those deadlines are determined by our clinical agencies. They need to make sure that you have all that documentation in place before they place you in their healthcare organization. And if they don't have those, then they can't place you. And so that's why it's so important to get your, don't put it off. Don't wait until the last minute. Write it on the calendar, put a sticky note wherever you can. It's really difficult to have conversations with students to say, you have forfeited your clinical placement. We have no other placement for you because you didn't get your documents in on time. And so now we're talking about an individual program plan, a delay in your graduation. And it's just so unfortunate because it's so preventable if you can keep track of your emails and your My Clinical Exchange. Again, the experiential learning team will go all over all of that. But clinical documents are so important. And not getting those completed, again, results in a forfeiture of your clinical placement. And that's just so unfortunate because it's such a preventable thing. So make sure you pay attention to those. When you see those emails, boy, keep your eyes and ears open for those and pay attention to them. These are just case studies. They represent common unexpected events, things that we've seen throughout our time here at the College of Nursing. And again, all of these are on an individual basis. They're in collaboration with the leadership team in terms of next best steps. So case study number 1, missed opportunities. Student C hasn't checked her email in the past week. She has a missed important clinical document. What should she expect? A, an extension on the deadline. B, a follow-up phone call from the College of Nursing asking where her documents are. Or C, an email indicating she has forfeited the clinical placement, program progression is delayed, individual program plan. So the correct answer is C, an email indicating that the clinical placement has been forfeited, progression will be delayed, individual placement. So just know that part of our mission here with our students is really preparing you for the professional practice of nursing. And so I don't get a phone call from University Hospital saying my CPR is expired. I don't get an extension on that deadline. It's really up to me to make sure that all of that clinical compliance is done as an RN. So we're helping to prepare you for that in your future. Course failure. Student D has failed the health assessment course. It's the first course failure. What should student D expect? A, to repeat the course at the next course offering in the traditional program. B, to meet with the academic advisor to discuss events related to that course failure, again, to help you plug into resources that you need to be successful. Placed on probation, be required to successfully complete a clinical progression course prior to returning, allowed to repeat one failed course. So all of the above. So again, take it again with the next course offering, meet with your advisor, be placed on probation, complete the clinical progression course. That's just a clinical progression course, is the course that all students take who's had an interruption to get them ready to come back into the program, and repeat one failed course. Oh, vacation in Hawaii. Student T is planning a holiday with their family. The holidays take place in October. In August, they contact the course faculty, ask if you'd be okay to get a plane ticket for the long week in October. What response should the student expect from the course faculty? A, Southwest Airlines has some great deals right now. B, you need to make a choice between your nursing program or taking the vacation. C, we can schedule your clinical and classroom time around your vacation plans. Or D, you should be able to switch your clinical time or original program plan with another student if it's scheduled during your vacation time. So basically, B, if that clinical time is scheduled during the vacation and we can't reschedule it, you can't switch it with another group, you can't switch your program plan, then basically it's going to be a choice, your personal choice. If you want to forfeit the vacation in Hawaii, continue with your progression, or if you want to, if this vacation is really important to you and important to your family, then we can talk about a leave of absence in order for you to take that vacation, interrupt your program plan, and then come back from the leave of absence. Let's see here. Fall schedule. This is actually from last summer, so we'll just skip that. Can I work outside of the program? That's a really frequently asked question, and everybody's different. Each student is different in terms of how much employment. Typically, most students find 12 to 20 hours a week doable. It depends on your own personal comfort level. Your employer needs to be really flexible with your ever-changing schedule. In other words, every 8 weeks that you're in school, so 8-week blocks, remember we talked about, you might have in spring of 22, OB block 1 and peds in block 2. Your clinical schedule is going to change. So in block 1, you might have clinical on Mondays and Tuesdays, and in block 2, you might have it on Tuesdays and Thursdays. So typically your schedule is going to change quite frequently. So therefore your employer needs to be pretty flexible with your schedule. I would say most students wait to start working until after the fall schedule. And if they're currently working, they typically decrease their employment hours through summer and fall. Orientations, class schedules, assignments will not be changed due to work schedules. How much time do I devote to my studies? Every student learns differently. We all need to spend about 2 to 3 hours for every hour you're in class to study. But again, everybody's different with that. Working on the on-site schedule, again, you'll hear more about that in your orientation. The other thing that I will mention about the blocked schedule for clinical courses, typically you will hear the term front loading with those 8-week blocks. And front loading typically refers to the first week or two, so week 1 and 2, that typically have very heavy didactic content. So for example, I teach complex care, which is MedSurg 2. It's an 8-week blocked class, clinical class. The first 2 weeks, we do all didactic, and that didactic is on Tuesday, Thursday, Friday, week 1, Tuesday, Thursday, Friday on week 2. Week 3 through week 8, we only have class on Fridays. That frees up the rest of the time to have clinical. So that's a pretty typical schedule for your clinical courses. OB and peds, it's the first week that you have heavy didactic, and then just class on Fridays. Mental health, same thing. But you will hear the term front loading, and it just means the front part of that 8-week block is heavy didactic, And then the rest of that block is going to be just class, typically 1 day a week, so that it frees up the rest of the time, including Saturdays and Sundays, for clinical time. So that's another piece with those 8-week clinical courses. You'll hear the term front loading. That's what that's talking about. That's all I have.
So Dr. Spencer, do you want to take it from here with the questions in the chat, or do you want me to take off? Keep
Sure.
verbalizing them, because there are some questions and you may not, maybe start at 9:29 a.m. if you're going to start with the chat, answering the chat questions.
Okay. 9:29. And Vicky's going to be here again, Amy?
She should be here at 9:45.
Okay. I go up as far as 9:53 a.m.
Okay, can you go back to 9:29, or you can't see those?
Let me just look. I can't see those.
Okay, I'll just keep calling them out. So
okay. I've got down, I think, type of shoes, certain dress.
So I'll just verbalize them. So I think you covered this, but the student is asking, if we take a leave of absence, do we start off where we left off, or do we have to retake classes?
You do not have to repeat any of the classes you've already completed.
Okay. And then there's a couple questions about the 74% for the classes. So what if we don't hit that 74% mark on a test, but do not fail the course?
So our current policy is students must meet a 74% cumulative exam average. If you don't meet the 74% cumulative exam average, even though you may, when you add in the other assignments, get higher than 74% for your total grade, that would still be a course failure because you haven't hit the 74% cumulative average.
So I think that covers Katrina's question as well. It's that 74% is the test average, Katrina, not the assignments and essays.
Correct.
Okay. Okay. Hang on a second. I'm just kind of scrolling down. Some answers have been added by other students. Okay, so for vaccinations and clinical compliance, is there leeway of a few days due to holidays and weekends, or is it best to schedule the vaccination a little early if holidays and weekends will make the compliance late?
That's a question for experiential learning team.
Okay. When will students be assigned a peer mentor? I think there's just been a recent shift in the student who's taken over the peer mentor coordination. Her name's Nicole. She'll be with us on Friday during the Q&A session. So I suspect, and you also met her on Thursday, I suspect she'll have an update. If the peer mentors have not been sent out, she'll have an update about what will happen next.
Yes.
Okay, so is there policy for missing a class or exam based on a class to class preference? For example, I am getting married on a Tuesday in September. So if I need to miss, if I need to miss a day or two, is that something to discuss with each professor or contact you for a life event situation?
Yes, that will be on course by course, faculty by faculty policy.
Okay.
So yes, contact your course faculty as soon as possible.
Okay, so we've just got another few minutes here before Vicki joins us. How does the front loading change course assignments and tests? Would we have more during that front load?
It really just depends on your course faculty, how they schedule exams and assignments. So it basically, I'm going to speak to complex care. So we typically have a test on week 2. We typically have an assignment due on week 2. So it really just depends on the course.
Okay. And so Vicki, I saw that you joined the session. Hang tight. We're just getting some questions answered here by Dr. Spencer. So I think this question is in the handbook, but I'll address it anyway.
Yeah.
For shoes, what color should they be?
I would try to make them as neutral as possible. They need to be closed-toed, no mesh top shoes, no Crocs. Think about a needle going through mesh and Crocs. So leather Shoes, they need to be clean. They can be tennis shoes. They just need to be clean and leather and closed-toed. And
Okay,
that's on the student handbook. You're right, Amy.
yeah. Okay, so you mentioned switching or trading clinicals with your classmates. Is this something we are allowed to do within our
No.
color groups?
No.
Okay. So starting on the 7th, will we be on Zoom or in person for Dr. Spencer's class?
Zoom. Everything is remote this summer.
With the exception of that 1 12-hour shift at UC Health.
Correct.
Okay. What will the COVID vaccine verification look like?
Experiential learning team question.
Okay, last week you mentioned that each color block has a 2-hour time slot within the 4 hours currently listed for the course. When will we find out our exact meeting times for our color block within that 4-hour time?
I will open up my course shell just as soon as I possibly can. It'll be in the syllabus.
Okay. How many tests can we expect throughout the semester on average for summer and fall semesters?
I have one a week. I think Patho probably has one a week too, but I couldn't verify that or guarantee that.
Okay, can we set up private meetings with advisors about online/campus information, and can we set up campus tours?
I don't know about campus tours. Amy, do you know anything about campus tours?
So we historically have not had campus tours. We've got a virtual tour that I can send out a link to students so you can kind of take a look. It's not unique to nursing, but it's Anschutz campus wide. I think, once we have a better sense from campus student services about access to campus, then I'd feel more comfortable kind of recommending that students come and just maybe do a self-tour. But I'm hoping to have more information from campus student services this week so that students kind of know what their access to campus will be.
Perfect.
Okay, is there a certain shoe brand you recommend?
Ones that are comfortable.
Okay.
You'll see all kinds. Danskos clogs are really popular, but there's all kinds. Just go try on a bunch of shoes.
Okay, so the student, this is funny. It's a weirdly specific shoe question. I saw that mesh shoes weren't allowed, but she's found some shoes online that have a mesh-like appearance, but are supposedly 100% waterproof and don't allow liquids in.
Perfect. Do they not allow needles or?
Right, I'd be more worried about the needles. Okay. Somebody said Clove shoes are a great nursing shoe. They're leather top.
Great.
Okay, I'm going over all this Clove dialogue.
Yeah. They don't have to be leather. They can be, as long as they're. Yeah. I know there's some people have gotten shoes, inexpensive shoes. They just need to be. You can't poke through them, splash liquids, all that kind of stuff. Okay. A lot of things land on your feet. Yeah,
and the last question about shoes. What is this hot topic? Somebody said, I see nursing students wearing New Balance. I'm assuming that means they're compliant. I would have just imagined if it meets the other things Dr. Spencer mentioned.
Yeah.
Okay. So this is really the last question before Vicki starts. Will we have access to the CU Fitness Center as a nursing student, or is there an additional membership fee? So I think that I saw that the Health and Wellness Center is having a gradual reopening on campus, but I don't think there's going to be any difference. In the past, students do have to pay a monthly fee to access the facilities. Now, it is an outstanding facility, I can tell you. I don't know where that stands now. I'll try to, in one of my emails this week, try to send you the link for the Health and Wellness Center, just so you can kind of see, what that opening looks like and how much the fees are. Okay. So I know that there's some additional questions, but I want to be respectful of Dr. Spencer's time as well as Vicki Shank's time. So Vicki, I'll go ahead and turn it over to you. I asked Vicki, and she is the bookstore manager at Anschutz, to first provide information about the bookstore hours this week, just so students are aware. And then probably she'll just be doing a question and answer session about scrubs and textbooks. So Vicki, I'll let you take it away.
All right. My name is Vicki. This week, the store is open Tuesday through Thursday from 11 to 2. I am usually here from 8:30 until about 3. So if you can't get here between 11 and 2, just send me an email or give me a call and we can set up a time for you to come in. Other than that, I'm usually here on Fridays too, from about 8:30 until 3. So we can always work something out on Fridays if you need Fridays. But on the weekends, the bookstore is closed and I'm usually not here on the weekends. Does anybody have any questions?
Vicky, do you prefer them to turn on their audio and ask you questions, or do you want to look in the chat? What's your preference?
They can turn on the audio.
Okay.
I have a question.
Yes.
Hi, Vicky. Are scrub tops readily available, or do we have to order them? Like if we were to go in person, are they already monogrammed, or do we have to order them to get them monogrammed?
No, they're already monogrammed.
Okay, so we can just come and purchase them in person.
Yes.
Thank you.
Yeah, it might be interesting, Vicky, if you can tell the students, I know when I had sent the email to students last week, I think that you were out of maybe the medium and the unisex top, but suspected that you would get them in. Are there any sizes that you don't have right now in case a student is wanting to come to campus this week to pick those up?
As of right now, I have all of the different sizes of tops.
Okay, and what about bottoms?
The bottoms, I am out of the petite, extra small ladies. I expect those to be in late this week or early next week.
Okay, and somebody asked in the chat if the bookstore is able to hem scrub pants. I'm guessing that answer is no, but I'll let
No.
Vicky respond.
No, I don't hem scrub pants. I don't even hem my own pants.
Okay, so there are a couple questions in the chat. Is there still a sale event for scrubs expected this summer or not because of COVID? So, or do you mean the used scrub sale by CUSA, I'm assuming, Katrina?
Yes. Yes.
Okay, yeah, we just were not able to coordinate that. And I know that there was talk about the potential of doing that. But as far as I know, and I don't know if Dr. Spencer, if you have heard anything else, I don't think we were able to get that together just because of COVID.
Okay, no worries. Thank you.
Sure, thanks for asking. Somebody else asked if they're coming in person to pick up things, do we have to let you know ahead of time?
No, if you're coming during store hours, you don't need to let me know. But if you do need something outside of store hours, just either give me a phone call or email me and we can set up a time for you to come in.
Okay, great. And then somebody asked about the Empower warm-up jacket. Do you have the sizes in those? She was specifically asking about a size large.
I do have more of those coming in. I just received a shipment and sent out most of what I got in to the students. There are more that are going to be expected, and those will probably be here late next week.
Okay, and then somebody had a question, if scrubs get damaged or they don't fit anymore, can we purchase nursing scrubs throughout the semester?
Yes, I'll always have scrubs here.
Okay, and yeah, we just recommend to start, please don't get more than 2 sets just to make sure everybody else has a chance to get scrubs initially. But yeah, I mean, Vicky's wonderful in terms of having supplies throughout. I don't see any other questions in the chat. Does anybody else have any questions that you want to ask through audio?
Yes, I have a quick question.
Yes.
I ordered, I think the ladies, top and bottom, and I got the unisex sent to me. Can I just exchange those in person?
Yep, you can just go ahead and bring those in.
Okay.
So I think that answers Susan's question as well about coming in and exchanging sizes. And Vicky, do you mind telling me your phone number so I can put it in the chat?
It's 303-724-2665.
Okay, I just put that in the chat. What other questions are there? Does everybody have their access codes? That is critical because you will need them for Thursday morning.
I have a question on that. Oh, never mind.
Sorry. I was just wondering, are there 3 access codes that we need in total, or is there more than that?
There are 3. You have the clinical skills, the SLS, and the access code for the pathophysiology.
Okay, perfect. Thank you.
I have a question about that actually. Because I'm a returning student, which access codes would I need? And do I have to repurchase them if I've already purchased them in the past?
The clinical skills and the SLS, if you have accessed them, those are good for 3 years. If you have already accessed the pathophysiology, that one is only good for 12 months.
Okay. All right, thank you.
I have a question on the access code. Should we go ahead and follow all the directions on our card to redeem your access code and like get it all set up for your presentation tomorrow? Or are you going to walk us through that?
I think ELT, the experiential learning team, walks you through that. Amy, have you set in on that session?
You know, I would probably just wait until tomorrow.
Yeah.
Because I'm sure they'll address it. And if they don't, please make sure to ask, Katie.
Okay, thank you.
Yeah, we had another student who asked about the instructor's ID for the clinical skills and SLS, and the answer from Dr. Bowler was, we'll walk you through all that during orientation.
Yeah, and somebody had a question going back to Vicki about how long do they have to exchange something that they purchased from the bookstore? Is there like a return time frame that they have to comply with?
If it's the scrubs, the sooner the better. I would just say probably until the end of the month.
I have a question for you, Vicki.
Yes.
Regarding, so you said you were out of the women's petite, and I think it was the extra small or something. If I came in on Thursday during my time to pick up the stethoscope, or before that, I guess, and get the tops, if we get the bottoms and the sizes that are out of, are those able to be shipped to us? Like, how does that work? Or do we have to come back in to grab those?
It's up to you. You can either place a web order for them and I can ship them when they get here, or you can come back in.
Okay, awesome. Thanks.
Okay, and so there are some additional questions in the chat. I do want to just address one thing that Bryant had said. He was planning to purchase the access codes in person, along with picking up my student badge and scrubs. That will only work, Bryant, if you're coming tomorrow. If you're coming on Thursday afternoon to pick up your stuff, you're not going to have it in time because the sessions are Thursday morning. So I don't remember off the top of my head what color group you're in. But if you're not picking up your supplies tomorrow, you're gonna have to figure out a way to get it before Thursday. So I'm gonna keep going here to see if I can catch these questions. So there is a student that's a returning student, Vicki, and she's asking, it says the APHO book is accessible for life. So how do we just renew the course point piece of it?
You would just have to purchase the new course point.
Okay, so I think we've already answered this. Do we have to order things before we pick them up, or they can just come in and see you, right? As long as the bookstore is open.
Yep, they can just come in.
Okay. Okay, so I won't have my access codes until next week due to being out of town. Can I just take notes while being walked through everything on Thursday? The ELT team wants you to have your own access to it. I don't know, Dr. Spencer or Vicki, if you have any suggestions.
It's somewhat challenging not to have that while they're walking through how to get all of that set up. I don't know if you could get an access code through the bookstore and then potentially return the one that you purchased. I'm not sure, Hurley, if you could do that.
I actually saw on the however you say the website that you get the SLS and the clinical access, but it said once you sign up for the specific class with their code, you can apply for a 14-day free trial. I don't know in practice if that's going to work with our classes, but it did say on the website, so that might be an option as well for people.
Yeah, I'm not sure, to be honest with you. Vicki might have some more information on that, but
no, I'm not sure about that either.
Mm-hmm.
So there is another student asking, does the Elsevier access card include several access codes?
Which access card was it? Was it the ebook access card or was it just the clinical skills or SLS?
I received the card, but it doesn't say if it's like SLS or anything. It's just like the Elsevier access card.
Did
Does
it
that
say,
include the SLS?
does it have a picture of like a student on the front?
No,
No. Did you buy a bundle?
I did. I bought the bundle.
You bought the physical textbook bundle?
Yes.
Okay, so yeah, so that one will just be the one access code, and that will give you access to both the clinical skills and the SLS.
Okay, thank you.
Mhm.
Okay. Oh, wait a minute. Another question just popped in. Okay, so the student purchased the SLS and clinical skills through the website over the weekend. The only option it gave was to ship it. Can I pick it up tomorrow afternoon instead of getting it shipped?
Yes, I'll just hold it.
Do you have her name, Vicki?
Yeah, she sent an email.
Perfect. Are there any other questions for Dr. Spencer or Vicki Schenk?
I have a question.
Sure.
So if I want to order the bottoms and they're not available, can I order them and then have them shipped to the bookstore and not pay for the shipping, or it's also you're paying for the shipping? I mean, I'm paying for the shipping.
If you just want to place the order, go ahead and send me an email and let me know that you don't want your order shipped.
Okay.
Then I can just go ahead and hold it here for you until you come and pick it up.
Sounds good. Thank you so much.
You're welcome.
No other questions? Okay. well, if there-
I'm sorry, Amy, I have one more question.
Oh, you're fine. Go ahead.
I just want to clarify. I think you already answered this, Vicki, but if we order the print bundle, the physical books, we have all of the access codes included.
Yes, it'll be included
Okay.
on that one access code.
Okay,
The
thank you.
access code is going to be found under the companion guide to the medical surgical nursing. It was in box 102.
Okay, so I see one question popped up, and I think we've already answered this, but I think that Tammy said that all the classes are virtual, but the nursing 3023, which is health assessment, says in person. Am I meeting on campus for that one? So I can take that one, I guess. All the classes are virtual. That class, because there is that one on campus clinical at UC Health, was the reason it was listed as in person, but all of the classes will be remote. Okay, so there's,
I have one more question if there's time.
okay, hang on one second, Monica. There was a question. I got ahead of myself, the student said, and ordered the book bundle and an SLS code. Can the student return the SLS code, Vicki?
Yes, as long as you haven't scratched the code yet.
Okay. And then Monica, what was your question?
I got the Elsevier access code, but I'm looking for the pathophysiology. I ordered that directly from the Lippincott Williams. Would it have come with that? I don't see it.
Would what have come with the
access? Is there a separate access code for pathophysiology?
If you order
email that you set that up with, if you ordered directly from them.
Oh, they sent an email?
Yeah, whatever email you used when you purchased it through that separate website, something, you'll get it in that email, the access code.
Okay, I'll double check that. And then the bottoms for the scrubs, I thought they were only available in unisex. Are they also available in women's sizes?
Yes.
Okay, thank you.
Okay, I don't see any other questions. So I guess going once, going twice.
Amy?
Yes.
I have a question to maybe you.
Okay.
You know how you said, I heard that there is the rank from 74%. Is that like weekly test or this is the final exam? I'm a little confused on that.
I'm going to ask Dr. Spencer to respond to that.
Your cumulative average of all your exams.
So the final at the end.
Well, it's not just one final exam, it's the cumulative exam average.
Okay.
Anything else? Okay, well, thank you, Vicki, and thank you so much, Dr. Spencer. We'll have a little bit of a break here. I'm going to stop the recording or just pause.
That's good. All right, so good morning, everyone. As Amy stated, I'm Jo, your financial aid liaison. And so today we're going to review a couple of things regarding financial aid and to make sure that you've applied for it. Go ahead and share my screen. All right, can I get thumbs up if you can see the screen just handout? Perfect, awesome, thank you so much. Okay, so let me go ahead and go on here. There we go. All right, so again, this is a financial aid session. The very first thing you want to make sure that you have done is most, if not all of you that have applied for financial aid have a financial aid award by now, because this is the first week of your term, your summer term. So you want to make sure that you do have financial aid and that you have accepted it and completed all requirements for it. If you do not have financial aid, you want to make sure that you did successfully submit and complete or update your 2020-2021 FAFSA to include our school code, which is currently on the handout 004508. If you haven't done so already, you definitely want to complete the 2021-2022 FAFSA. It is available now, so go ahead and get that completed as well so that you have no delays in your fall financial aid. And so just a reminder, the FAFSA is due every year for the duration of your program. So come this October 1st, you will want to submit that new FAFSA that's going to go live, which is FAFSA 2022-2023. So just make sure you put a calendar reminder on there on October 1st, fill out that new FAFSA. It is very important that you do so because we do award any grant funding first come, first serve. And then you also want to make sure that you're monitoring your to-do list. If we need anything from you, whether it's verification documents, income documents, or anything like that, we will notify you via the UCD Access portal and the to-do list or via student email. So you want to make sure that you're monitoring your student email account because that's the only email. So as far as financial aid goes, all disbursements of financial aid that was accepted and to-do list requirements completed. So all of that financial aid is releasing to the bursar's office this week. It is going to be applied to your balance in the next couple of days. And then if you accepted more than what your balance is, that refund should be issued by the bursar's office, either direct deposit or paper check, depending on whatever you set up with them. That refund will be begin to be issued towards the end of the week. So be on the lookout for that. If you know you accepted financial aid and you see that the financial aid was applied to your balance, but you're not seeing any information on a refund, you can go ahead and contact the office and they'll give you a status update. I do have their phone number on this handout and we'll review that in a little bit. I did go ahead and include the 2020-2021 cost of attendance table on here for resident students. If you want a more detailed breakdown of this, it is available on our website. But I mainly want to come down here to the awarding financial aid side. So again, most, if not all of you guys should already have an award. Your award will consist of your remaining Stafford loan eligibility. Now, the thing I want to point out is that your program is unique in the sense that you're starting in the summer semester, which is basically the end of an academic year for us. The academic year runs fall, spring, and ends in summer. And so this is going to be the only term for the program, that the duration of the 2 years you're here, that you're going to have access to all of your Stafford loan eligibility in one term, okay? So what that means is that in the future for the fall 2021, when we award you the Stafford aid, whatever you accept is going to be split evenly between fall and spring semesters. And then if you have any Stafford loan eligibility left over, which typically that's not the case, typically most students use it during fall and spring, but if you have any left over, then we will award that remainder for the summer 2022. And so this is the only term that whatever we award you in Stafford aid, you're gonna get it all this semester. And I bring that up because as you're aware, the Stafford loan limits for your program, depending on dependent or independent statuses, are very limited. So the max you can get as an independent is $12,500 in Stafford loans. And so that usually is used up between fall and spring semesters. So we do have some students that like to plan ahead in the sense that they accept the max they can this summer term, because this is the only term they're going to have that money in one semester. And then they kind of use that to offset the cost term by term. So maybe you could get a larger refund this summer semester if you accept all of your aid, and use that refund to help pay for fall, and then use fall's refund to help pay for spring, and then use spring's refund to help you pay for summer. And so that way you kind of get the max funding to try to get you through most of the next academic year. The only caveat to that is that you are borrowing more this semester, so it's a higher loan debt, and that might be the only drawback. But you know, I leave it up to you guys. You can kind of think about it. If you want to discuss if that's a good idea for you, you can definitely give me a call and we can kind of go over your file and see what your best plan would be. If you're taking out private loans, it's probably a good idea to just give me a call so we can discuss what kind of refund you're looking to get every semester. Unless you're trying to get max refunds, then if that's what you want, you don't have to worry about giving me a call. I will always maximize the refund that you can get if you apply for a private student loan and I don't hear anything else from you. But there's that, just kind of food for thought there. Let's see here. Oh, another thing is if you charge your books to the bookstore, or if you did charge your books to the your bookstore books, if you charge them to your student account, that means that it was added to your bill, right? And so what you want to make sure that you do is that your balance, your complete balance is at zero before you spend any of the refunds that you receive this semester. And the only reason why I say that is because financial aid can only be used and applied to tuition and fees. So book expenses are not either tuition or school fees. And so you would need to authorize aid to pay all charges. If you didn't do that, then the bursar's office will still issue you a refund regardless of you having a bookstore charge. And then you need to take that refund and pay whatever you owe on the bill due to the bookstore charge. It's important that you do that because if you don't, then you're going to get, late fees every month and it's not going to be a good time. So please make sure that your balance is in fact at zero before you spend any refund that you receive from the bursar's office. All right. Back up here, if you're a Colorado resident, you want to make sure that you authorize that COF. I would even recommend that you make sure that it's applied on your student bill. There's on the bill breakdown on the bursar side of the student portal, you can see what's been charged and applied to your balance, and you can verify if COF is on there. If you haven't received any notification of disbursement, or if it's the end of the week and you haven't received anything, I would suggest that you make sure that you completed the appropriate entrance counseling and master promissory notes for those Stafford loans to release. Work study award, if you submitted a work study request form, those are now being processed. So you should be hearing something from that shortly. Special circumstances, I should note that reconsideration of income appeals, those won't be eligible for the summer term because we usually don't have any grant funding left. But that is something that we can discuss for the upcoming fall 2021, if that's something you guys are interested in. Computer purchase appeals, you know, if you need help purchasing computers, just make sure that you know that we're still bound by the Stafford loan limits. So if we process any type of appeal for you, it's likely that you'll have to apply for a private student loan, or if you're a dependent student, it'll be for a Parent Plus loan that your parent would apply for. We also have childcare appeals on here, so that information is all the same. Just information about grants and scholarships, the COF stipend. I went ahead and put on here our Stafford loan limits. So, you know, these limits right here, 7,500 and 12,500. That is for the academic year, which means it starts in the fall and ends in the summer for us. If you guys are interested in private student loans to help you fill in the gap between your Stafford aid and your cost of attendance, we do have information about those loans at this following link. We typically don't have any lenders that we recommend. We will work with any lender of your choosing. You just want to make sure that you vet them properly before applying with a third-party lender. And yeah, right down here, I do have the bursar's office phone number, the website to College Opportunity Fund if you haven't authorized our school, and any other information here that may be important for you. So I'm going to go ahead and stop sharing and go to the questions. Let's see here. We have a few questions. Okay. So the first question I have is, have the scholarships that didn't require FAFSA been awarded yet? Amy, I do believe, I'm not sure what the status of that is. I do believe that College of Nursing makes the final decisions on the recipients, but I'm not sure where we are in the upload process. If there's any for summer term, I'm sure they would have been uploaded by now, but I'll go ahead and leave that question for Amy.
So yeah, the scholarships that students applied for within the College of Nursing, those are going to be fall awards. Okay. And so it will not be applicable for summer. And off the top of my head, I just cannot recall if, or I just can't recall when students will be notified, but it'll be closer to the start of the fall semester. And I also want to take this moment, Joe, and just say, Sandra Tapisaria, who was our senior admissions analyst, for students who don't know Sandra, she let me know that there's still a few students that we need spring transcripts for to get them to that junior status. And then, as you may have heard from Sandra, there were some issues in the system, and she has entered all the transfer credit that she can. But there may be some students who that junior status has not quite hit, you know, that 60, as you know, we deal with this every summer. So I know Sandra will keep you updated, but for the couple of students who we still need spring grades to get you to that junior standing, I'm emailing those students this morning. So please go ahead and request an official transcript to go to NursingCast, and then also please send me as a placeholder an unofficial copy by email.
Okay, so yeah, if you happen to be one of those students that doesn't have an award yet, it is very likely that it's due to that spring transcript issue. So be on the lookout for Amy's email, because that's going to be very important to make sure that we get you awarded very soon. Okay, so let's see here. I filled out my FAFSA about 2 months ago and have not received any offers for summer semester. Yeah, you should have received that already, Abby, but I guess we would need to check to see why you haven't. There may be something pending on your to-do list, or you may be one of those students that Amy was mentioning earlier. So giving us a call would definitely help us kind of figure out what is wrong with, or what is happening with your file preventing an award. Let's see here. What if the FAFSA award has not opened for me yet? It's that very same thing. We would want to that you completed the FAFSA, the correct FAFSA, so the 2020-2021 FAFSA. A lot of you guys that were enrolled at a different school during fall and spring probably, you know, put their school code, but you had to make sure you went back and added hours and saved and submit before we got it. So we want to make sure that we have your correct FAFSA, and then, you know, that you're that junior senior level on the system before we can move forward. So giving the financial aid office a call would be best case scenario there. Yes, you will want to contact someone if you have not received your financial aid award, or check your to-do list in the student portal. If you see something listed on there, that's the reason why you haven't gotten an award. But if you don't have a to-do list, then give us a call. Unless you get that email from Amy, then you know what the problem is and you want to address those transcripts first. Yes, so let's see here. Yes, the student interests are at 0% until the last day of September. Yeah, and it is risk and cost free in the sense that, you know, you're maximizing the Stafford aid that you're taking out this semester. And yes, you can always pay back the unsubsidized loan even while you're enrolled in school as a voluntary payment without any penalties. Do you know when insurance charge will be taken off our bill? I do not. Those should be, what happens with those is if you receive the email from the Student Health Insurance Office indicating that you were approved for that waiver, then you just basically need to give it a couple of weeks for them to process it. The Student Health Insurance Office sends the bursar's office an email with a list of students that have been approved for that waiver, and then the bursar's goes in and waives those out of their bill. But don't know where they are in the status of that. So I would give them a couple of weeks to process. And then if you don't see any updates, then go ahead and contact the Student Health Insurance Office.
And I can comment on that. I did get an email from Rebecca Brannon the other day, which was an out of office, but on her out of office, it said, let me just read this real quickly. So the tuition and fees can be paid before or after a waiver is completed and approved. And she's saying simply pay the tuition and fees less the student health insurance fee, which is $867, or pay the full amount and receive a reimbursement upon waiver approval. So I don't know exactly how long it's going to take, but Rebecca will be joining us on Friday for our morning session, so she can talk further about it then.
Perfect. Just to clarify, the award we were awarded this summer is different than what we could get for fall? Yes. Yes. So because the summer semester is the end of the academic year for us, yes, the award that you get for this summer semester is going to be separate than the upcoming fall 2021 award because your annual limit resets in the fall. So it's a new $7,500 for dependent students or $12,500 for independent students. So yes, it'll be a new award, a separate renewed annual limit. Let's see here. If we need to take a leave of absence, do we need to pay back all of our loans before returning to school? That is a very loaded question. There's a lot of things that go into that. First off, we would need to talk with you to see what term you're thinking of taking the leave of absence. If you're going to be completing the semester or if you're going to withdraw halfway through or before it even starts, that is going to have impact on any aid that you'll pull back that semester. And then depending on how long you're going to be out, you may need to start making payments because you will enter repayment. But then you can always go into in-school deferment once you return to school. So there's a lot of things that are associated with that question. So I would say if you do need to take a leave of absence, you do want to talk to, your academic advisors first, Amy at College Nursing, and then she'll likely send you over to me, and then we'll discuss the financial aid aspects of your leave. After our insurance outside of the program has been accepted, how long does it take for it to get off of the bill? It's going to be, we're not sure on that just yet. When do we need to submit appeals for fall? It depends on the type of appeal that you're submitting. The reconsideration of income appeals take about 6 to 8 weeks to be processed. So those ones do take a long time. If it's a computer appeal, those are typically 2 to 3 weeks. Childcare appeal, about the same time frame. I applied for COF a couple of semesters ago when taking a class through CU Boulder. When I went to reapply, my information was still there and it looked like there wasn't anything further on my end. Can you confirm whether or not I need to reapply? I cannot confirm that, but if you reach out to the registrar's office, their phone number is on that handout. They can let you know if you have authorized COF on our end, because you do need to authorize it at both places. At COF, you need to add our school, and then on our student portal, you do need to authorize COF. So if you contact the registrar's office, they will let you know what status you're at and what you need to do to successfully apply that. Other scholarships for DACA recipients. I'm not sure. I don't think that there was any sort of citizenship requirement for a lot of those scholarships through College of Nursing. So it's whatever is dictated on those scholarship applications, but there are some that are not dependent on citizenship status. Let's see, what is the agency or company that the loans are being supplied from? Where do we go when we have to pay back our loans? Okay, sure. So your lender will be the U.S. Department of Education. They will choose a loan servicer. We don't know who your loan servicer will be until you accept aid and are awarded it and are issued a refund and stuff. That's when you'll receive a letter from your chosen loan servicer, which would be places like Nelnet, Mohela, Great Lakes, Fed Loan Servicing. There's a whole bunch of different ones. So you'll know exactly who your loan servicer is once they've been chosen by Department of Education to service your loans. And so then that's where you would go to make back any payments, or to start repayment, or to make voluntary payments while you're in school. You will just contact that loan servicer. We would recommend setting up an online account with them so that you can see, you check your loans whenever you want, and you have access to it at any time if you set up that online account with them. But you would have to wait until there's a disbursement for you to know who your loan servicer is. Okay, there's a question for Amy. Yes, so it does look like you're asking if they're still upgrading our status from last week. Yes, so it does sound like Amy does know of a few students that are still being updated. So be on the lookout for that email.
Yeah, I think, if you don't hear from me by email, students, just assume that we have your credits. It just may be there's a delay with updating the system. I do know that Sandra had entered all the credits that she had, but there is a slight delay in the system before Joe can see it on the financial aid side.
Yeah, so I mean, if you don't get that email, I would say, it's probably a good idea to check your student portal for your to-do list. And if you don't see anything, then you definitely want to give me a call.
So can I just say something really quickly? Sorry.
Sure.
I did just call financial aid, and for some reason mine did not go through, although the award was there. So they did have to manually push it through. So that may be the case with some others as well.
Mm-hmm. Yeah, so, and that's why it's best to just give us a call so we can figure it out and get you squared away. Okay, how do Parent Plus loans work? Do they accrue interest while I'm still attending school? Would my parents need to sign paperwork? Also, is there any way to transfer that loan from the parents to the students after we graduate? Okay, so Parent Plus loans is exactly, it is a loan that the parent of a dependent student would take out for them. So if you're not considered a dependent student, we will not award you that Parent Plus loan, so you won't be eligible for it. But if you're dependent, then it will be on your award. Yes, the parent will need to complete a Parent Plus loan application and pass a credit check and complete a master promissory note for plus note loans. So there is activity on the parent's side that needs to happen before we will release any of the Parent Plus loan. It does accrue interest while you're enrolled in school, unlike the subsidized Stafford loan. So yes, it will accrue interest for your parents while you're enrolled in school. And I don't believe there's a way to transfer it out of the parent's name once you graduate. But there are new programs coming up every few years. So maybe by the time you graduate, there might be something. So, that's at this point, I don't believe there is, but in the future, that may be a possibility. VA scholarships. Yeah, I'm not sure how those scholarships or third-party payments completely work, just because there's different types of plans for VA scholarships or third-party payments. So let's see. It's basically something where that money is paid to the bursar's office to be applied to your balance. Depending on the type of benefit you have, it may count as financial aid. So we'll have to, it may count towards your cost of attendance. And we may have to make reductions to any financial aid. But it's best to give us a call so we can first, if it's a VA specific type of payment, you work with the Veterans Affairs Office to make sure that everything is processed correctly. But then after that payment has been made, we can definitely look into what financial aid eligibility you may have. But yeah, I'm not as familiar. There's just so many out there that I wouldn't be able to answer this question specifically, Jade. Okay. If we already accepted loans but did not accept the full amount, can we increase what we request even if it has already been processed? Yes, Molly. So if you didn't accept your full amount, you can definitely give us a call and ask us to reoffer the rest. If you want to wait until towards the end of the semester, you can do that as well. But yes, you can always change the accepted amount even after the aid has been released. How do I remove cough? Remove cough, like if you don't want it, I'm not sure. I think maybe what you're asking is, how do I have cough applied to your balance? It is automatically applied if you authorized it correctly. So if you don't see it on your bill as applied, then you would want to either reach out to the registrar's office to see the status of the authorization, or to the bursar's office to see when they're going to apply that cough. But it is automatically applied. Let's see, Bryant is indicating that there is no award received yet, but it's saying that my FAFSA was received. Can you clarify if I wanted to use financial aid to pay for the textbooks bundle from the bookstore? Yeah, so basically you would call the bookstore and you would, or go in and make that bookstore bundle purchase, and then tell them you want to charge it to your account, and they'll charge it to your Bursar's account. And then you would accept aid to help you pay for that. If you authorize aid to pay all charges, then it'll automatically be applied to the balance that was created at the Bursar's office. If you don't, then you'll get a refund from the financial aid that you'll go ahead and pay to the Bursar's office to make sure that your bookstore bundle is paid off. If I were awarded If we were awarded financial aid but decided we don't want it, do we have to reject it or can we ignore it? Tracy, yes. So if you don't want that financial aid, you can definitely reject it. You could ignore it. It's probably best to go reject so that we don't keep sending you communications about it. So just spoke with Carl from financial aid and asked about the due date for the tuition. He said he saw May 31st. Yet there's also conflicting date that shows the end of June. Yes, you would need to contact the bursar's office about due dates. Anything that has to do with billing, we're not in charge of, so we can't really give you an exact date. What we can do is give you the date that's on the system, and it does look like what we're seeing was, May 31st, but it should actually be. So definitely the bursar's office would be the place to call to confirm that date. Everything looks good and I still have not received my, okay, Chanel, if you haven't seen anything, you may wanna hold off for today to see if you're one of the students that Amy emails. If you don't receive that email tomorrow, you would wanna give me a call so we can look at your file, Chanel. Allison, accepted my loans. Do I need to do anything to pay my bill or will FAFSA automatically do that for me? So if you've accepted your loans and you've completed the requirements like the entrance counseling and master promissory notes, we will automatically release those funds to the bursar's office in the next day or so. And so that will be applied to your balance automatically. Please share your contact information. So it is on that handout, but basically the phone number is 303-724-8039. And my name is Joe. So let's see here, Melody, I have a to-do in the to-do list. They said the FAFSA has been received. Is there something else I should do or is this just a notification? Yeah, so it's just a notification letting you know that your FAFSA was received. And so if you have an award, great. If you don't, then there's something we need to probably look into on your file. So Julie is saying the same thing, but I have already accepted the aid, did the module, signed the documents, and applied to my account. Why do I still have a little red icon saying something needs to be done? Julie, I'm not sure without looking at your file specifically. So if your financial aid has already dispersed to the bursar's office, then maybe it's an icon letting you know that maybe you have to set up direct deposit or authorize aid to pay all charges. But I'm not sure. There has to be something on the portal that tells you specifically what is being asked of you. But if your financial aid has released, then it's likely nothing to do with financial aid. Chloe, if I don't plan on using FAFSA or taking out loans this semester, do I still need to apply for it? No, if you do not plan or want to take out Stafford loans or aid, then you don't have to submit the 2020-2021 FAFSA for this summer. If you do want to accept aid for fall semester, then you want to make sure you complete that 2021-2022 FAFSA. Let's see, Julia, what is the last day to submit our payment before we are dropped or get late fees? I'm not sure. So double check with the bursar's office on where when their due date is. And then late fees, I do believe that's going to be, I think census date should be sometime at the end of this week. So late fees will happen the start of the following week. So it should, yeah, I would say just double check with the bursar's office on that due date. Laura, can we apply for the COVID-19 grant? No, so that's not a grant that you apply for. We automatically went in there and awarded it to our students that qualified for the spring semester. It doesn't, right now we're kind of As we get funding, we're trying to determine how to release it to the max amount of students possible. So there is nothing that you as a student have to do. As we get that funding, we will automatically start awarding it out. But for now, we did award the grant funding to the spring term students. And then as we get more, we'll see where we go from there. But you will receive notification. But there's nothing you actively have to do at this point. So Molly, I have other federal and private loans from my previous degree. If our new federal loans are from a different loan supplier, can we merge those loans with the current loans? I see. So once you, right now, while you're enrolled in school, you be in what's called in-school deferment. And so you will not need to make any monthly payments. But once you graduate, there are various options, and there is an option to consolidate. If you want to consolidate loans from multiple loan servicers into one, you can at that point. So once you're closer to graduation or at graduation. Isaac, I accepted my aid, but I needed it to not be applied to my tuition, as I have funding for my tuition that can only be applied to tuition and a refund. Is it possible the disbursement and have it applied after my tuition funding goes in? Yeah, so this is a good just thing to know for everybody. If you accept financial aid, we will release it. We cannot place a hold on it. We cannot have it not apply to your balance. We have to release it per federal regulations according to the disbursement schedule. And so yes, if you have some type of payment coming in that can only be applied to your tuition, then you would want to have us cancel your aid and then reissue it at the time that you are ready for us to award. So what is the difference between the Parent Plus and federal direct loan? Can we still accept the direct federal loan if you are a dependent student? Yes, you can definitely accept federal loans. Federal loans are the Stafford loans. It's the subsidized and unsubsidized Stafford loans, and those are loans under the student's name. The Parent Plus loan can also be considered a federal loan, but it's a loan under the parent's name. And that's mainly the only difference. The Parent Plus loan is under the parent's name, and it is only available to dependent students. Last year, someone mentioned the University Need Grant. Is this still an option for students? So yes, the University Need Grant is something we automatically award to students, but it is a grant awarded during the fall and spring semesters. Because the grant funding is limited, we run out of it for the summer term. So it's not something that's awarded in summer, but it is something that will automatically be awarded to qualifying students during the fall and spring semesters. Okay, so someone asked, after accepting the aid, do the funds get dispersed right away? No, so it only gets dispersed once disbursement dates are upon us. So for you guys, for this summer term, aid is starting to release to the bursar's office this week. But after this week, like if you accept aid, it'll usually be about 3 to 4 days for it to release, so long as everything's completed. So Alicia is asking, is there a deadline to accept loans for the summer term? Yeah, so the deadline is basically a week and a half before, I would say a week before your summer term ends. That's the latest that you want to accept Stafford loans or student loans by. All right, so Jasmine is asking, I've got 20 minutes. You mentioned that parents will need to go through a credit check, but I was already offered a Parent Plus loan. Does that mean that if their credit does not meet the requirements, then I will not be able to take out the loan that I was awarded? What is the credit score needed to take out these loans? Okay, so we will award, just because we award that Parent Plus loan to dependent students doesn't guarantee that you're going to get it. It is awarded on the system, But if your parent is going to apply for it, they would need to go to studentloans.gov and complete the PLUS loan application. When they complete that, it is going to authorize that credit check that's going to run, and they will automatically be told when they're in there applying for it if they're approved or denied for that loan. So you'll know. Now it's not a loan that we necessarily approve or deny, so there's no credit score I can give you. They're not really looking at your credit score in the sense of they're looking high credit score. They're more looking at credit history and worthiness. So, do you have a bad history of missing payments or anything like that? They're not necessarily looking for like the highest credit score that you can have. But that is something that your parent will know right away when they're applying for that PLUS loan application. So let's see here. Hope I didn't skip any. Okay, so Katie, are there any aid adjustment options for dependent students who will not be receiving any financial aid assistance from their parents or family? Unfortunately, no. If you're considered a dependent student by FAFSA, for FAFSA purposes, then we only really can award you the dependent levels of Stafford aid and Parent Plus loan. If the Parent Plus loan is not something you're going to be interested in because you're not going to be receiving that parental support, then a private loan would be the next option to help cover the gap between the Stafford aid and your cost of attendance. Tessa, thank you so much for putting that phone number on there. But yes, that is the financial aid office phone number. Peyton, is there a limit to how much financial aid we can receive? Yes, there's an annual limit and there's a lifetime limit. The annual limit for dependent students is $7,500. For independent students, it's $12,500. And then for the lifetime limit for independent students is $57,500. And then lifetime limit for dependent students is $31,000. So Julie, I'm sorry, I believe you already addressed this, but my tuition was covered today by my financial aid award. Perfect. I still have a charge on my account for my bookstore charge. How do I get financial aid to cover that payment? Yeah, so basically you want to make sure that you authorized aid to pay all charges. The bursar's office has a how-to PDF on their website. So it says how to authorize aid to pay all charges. And basically it's a screenshot of what you have to do. And so you just follow those steps and you'll authorize aid. At this point, I don't know if you authorize aid today, I don't know if it's still in time for the bursar's office to apply that financial aid to the balance. So I would just say double check if you authorize it today, will they still use financial aid that they currently have and apply it to the bookstore charge? Or are they going to just issue that refund and then you have to turn around and pay it? But they do have that how-to PDF on their website. Let's see here, Laura, if the university need grant, is the university need grant based on EFC? EFC is the expected family contribution. If you're a dependent student, great. If you're an independent student, it doesn't take into consideration family income. That's just the name of the number, expected family contribution. It is something that you get on your student aid report when you fill out the FAFSA. Yes, you do need to have a qualifying expected family contribution and a history of need to be eligible for the university need grant. Let's see, if we pay our bill before financial aid is awarded, will the financial aid award all just be dispersed to me as a refund? That is correct, Shannon. If your balance is zero, when we release the financial aid, the bursar's office will see that your balance is zero, so they'll just issue that refund out via direct deposit or paper check, whatever you have set up with them. Okay, so in regards to the $57,500 for independent students, is that in regards to aid that has not been paid back? As in, once loans are paid off, can we receive more aid? I see. Yeah, so basically, let's say that 57,500 is the lifetime limit. But if you've paid back any of that money, then yes, you are eligible for it again for the duration of your undergraduate degree. So any money that you paid back, you can get again, of course. Let's see here. Jamie, if we were approved to opt out of the school's health insurance, how will that cost be reimbursed to us? Will a payment plan be adjusted in that case? Yeah, so Jamie, if you were approved for that school's health insurance waiver, then basically it's, you know, if you've already paid it, then once the waiver is processed by the bursar's office, they'll give you that money as a refund, either direct deposit or paper check. Or if you choose to just pay tuition and fees and not pay that health insurance, then it's just gonna, you know, fall off your bill once the bursar's office processes that waiver. But, you know, if you did pay it with financial aid or something, or with a payment you made, you will get a refund for it once that waiver is approved and processed. Will a payment plan be adjusted in that case? It should definitely, but I don't think it's an automatic process. Or in fact, I'm pretty sure it's not an automatic process. So if you see that waiver come in, you will want to contact the bursar's office and let them know that you had a predetermined payment plan that included the cost of that health insurance, but now it's waived. And so you want an updated plan and payment schedule, and they will go ahead and help you figure that out, because I think the payment plan is like built outside of the portal or something. So they have to do something to make sure that that is updated correctly. So you will want to make sure that you call the bursar's office if there's any adjustments needed to your payment plan. And that reminds me, like, let's say you set up a payment plan before financial aid went through, and you accepted in a financial aid to pay off your entire balance. Your balance is at zero now, but you still had set up a payment plan. You will need to contact the bursar's office, because they will not automatically stop charging you. Even if your balance is at zero, if you had a payment agreement in place, they will charge you the amount agreed upon on the date agreed upon, regardless of your balance being zero. So you will want to contact the bursar's office to make adjustments to that payment plan. Okay, let's see. If we pay all the tuition and have just the insurance left, will we get late fees applied on it? You know, I believe late fees may be applied to it, but the student health insurance office, I'm sure, could do something about asking for those late fees to be removed. But yes, I do believe that any balance, any unpaid balance, will result in late fees being added until that balance is paid off or removed. Is there a deadline for setting up a payment plan? Yes, there are deadlines for it. Deadlines are mainly, if you sign up by X date, you can divide your payments into 3 months, or, you know, into 2 months, or, you know, whatever the options are. I don't know what the exact deadlines are. They are listed on the Bursar's web page. Here, I think, oops, meant to send that to everyone. Okay, Ginny, thank you so much. So Ginny is going to go ahead and send that link to the billing calendars that you can take a look at. All right, is there a deadline? Okay, thank you. All right, so I think at this point I have answered all of the questions in my chat. I will go ahead and, oh, there's one more. If anybody else has any other questions, now's the time to unmute and go ahead and give me, tell me your questions. But I will answer Katrina here. I just want to confirm that the due date for tuition is June 30th. I want to say that sounds correct for you guys, but I would say double check with the bursar's office, because they're the ones that would know the final date. And maybe they can even make the updates to your due dates on the portal, because I know a lot of you guys have May 31st, but they can make that update.
Yeah, I think it depends, Joe, on when the students registered. So that's why I always recommend the students check their individual portal to determine the due date.
Okay, thank you. Yes. So student portal, if whatever date that's on there, if not the bursar's office, you were asking for their number, I will go ahead and put it in the chat. It's, but I'll also tell it here. The number to the bursar's office is 303-315-1800. Let's see. Do you have a number to the bursar's office? Yes. All right. Where on the portal is the due date? It's going to be when you log in and you go to Student Center, there's going to be a icon that has, it's a money icon that says billing. If you click on that, it'll take you to your billing statement. And at the very bottom, it'll give you your bill due date. Laura is asking, what is the school code? I went ahead and put it on the chat, but it is 004508. When you put that number on the FAFSA, it is going to say University of Colorado at Denver, and that's fine. We share the same school code, so we will receive it. Miranda, what if I pay my tuition before my loans go through? Will I get a refund? Yes, if you pay your tuition and your balance is zero before your loans go through, once your loans are released to the bursar's office, you will be issued a refund because your balance is zero. So you will get the full refund.
I also wanted to jump back to, I think Sonia had a question about what's the time frame for someone to be considered in state. I don't think you had talked about that, Joe. So that's gonna be based by the registrar's office. And Sonia, if you want, send me a quick email and I can email you the link to the guidelines to establish Colorado residency. I'd prefer that you look at that page just so you understand all of the requirements. And just know that there is a time period before each semester starts that students can petition for a change in the residency status.
Yes, thank you for that. I'm sorry, I may have accidentally clicked on something where I may have skipped a few of your questions. And if I did, please, let me know or put them back in the chat so I can address those. Yeah, because at one point I saw I had like 20 something comments and all of a sudden I didn't see them. So I thought I just caught up. But yeah, if I didn't address your question, please put it back on there. We still have a few more minutes.
When we maximize like our loans and we take them all out for the summer semester and we get that refund to be able to use it for like the following semesters, when you say it comes like in a check, do we just like hold on to that and then apply that or use that for the next semesters when we take them out?
Yeah, so so basically it would come in either a check or direct deposit if you set that up with the bursar's office, right? And so yeah, I would even recommend if you could, because if you're not going to need that money and your purpose of accepting all of the aid was only so that you can maximize your Stafford loan for the next year, then I would recommend even putting it in a savings account, of interest on it for the next 6 months or whatever months, 12 months, so that you could use it next summer. That way you're getting some interest on that while you have it and you don't need to use it for anything else. But yes, you definitely want to make sure that you cash the check, because if you don't cash it, it's going to expire after 120 days. And then there's a possibility of not being able to reissue it if the summer term is over. But yeah, definitely keeping that handy somewhere in some type of account so that you can use that to pay for the following term, or just keep it in there and use it to pay up until the summer of 2022.
Always just take out the maximum to be able to get that refund for like you were saying, some students take it all so we can pay off.
Exactly. Yeah, exactly. So you just basically take out all of the Stafford aid that you're awarded, both the sub and the unsub, and then, whatever goes to your balance, great. And then that excess funds, that's what you're going to keep until the next term, until next summer.
Perfect, thank you.
Of course. Okay, so Jamie, where would you see COF grant? So it's a COF stipend, College Opportunity Fund stipend, and you'll see that applied on your billing statement. You won't see that under financial aid because it's not something that we process, but you'll see it applied under your billing statement. Oh, Bree, thank you. Check your statement balance. There you go. It will be in the statement summary. So Axel, are your advising hours still the same for the summer semester? That's right. So if you want to speak specifically with me, which I would recommend, I am available Mondays and Fridays from 12 p.m. to 3 p.m. and then Wednesdays from 8 a.m. to 12 p.m. If you are unable to call during those times, you can definitely call during other times. And then any of my colleagues will be able to answer your questions. But yes, my advising hours are the same all year long. All right, any other questions? Okay, so Molly, talk to someone else in the financial aid right now. They said the items listed to do under the financial aid for 2021-2022 FAFSA received is staying there because they had to leave one thing in the to-do list, but it is done if it says that. But he said we should only see that as a pending to do. If there is something else, then there's something that still needs to be done. Yes. Also, for a refund for taking extra financial aid, he said go through the bursars on student accounts on the UCD Access to add direct deposit info. Yeah, exactly. So you know, direct deposit is something that's handled by the bursar's office. And so that's why you would have to set that up through the bursar's side of the UCD Access portal. But yes, that's definitely the way to go. If you haven't set that up, I would recommend you do that today so that you can get that refund issued a lot faster, because direct deposit is done on a daily basis. And so it goes directly to your account. Mailing checks, especially during COVID or, you know, all this time and mail and everything, it's basically snail mail. So it's going to take a while, maybe a week or so before you receive a refund. What is your email address? Yeah, so it'll be just the general email account for the financial aid office, which is fin.aid@cuanschutz.edu. Can I confirm all of that? Yes, Molly, so definitely that's correct. The 2021-2022 FAFSA is going, I'm sorry, 2020-2021 FAFSA is going to state received on the to-do list. And yes, you can set up direct deposit via the student portal. Amanda, thank you for putting that email on there. I would suggest to still email the University Anschutz account because my priority is given to student questions that are coming through the Anschutz email account. That one would be more department questions and stuff like that. And right now I have 100+ emails in there. I just got back today, actually. So it'll take a while for me to be able to reply to any emails sent to my direct email account. But either or works. But definitely if this is more of a time sensitive issue, I would say give me a call so that we can get that handled right away. Thank you so much for all of this info. Thank you. All right, so I think I have another minute if there's any other questions. Can you say your phone number? Sure, it's 303-724-8039. And let me go ahead and add it on here again. 039. And my name is Joe.
Thanks again, Joe. I know this is always such a busy session for you. We appreciate you taking the time, and I'm going to go ahead and pause the recording, students. So really appreciate it.
Yeah.
You guys.
Thank you.
Yep. Take good care, everyone.
Yeah.
Okay, thank you. So welcome to the College of Nursing. My name is Ryan. I'm one of the instructional designers, so I will mostly be helping out with faculty to help them to make sure that your experience in your classes is as amazing as it can be. Today we'll be kind of looking at a few things for Canvas. So getting started with your Canvas content, figuring out some of the settings that you can have for notifications, and then your Canvas profile, and then going over some of the material you should have access to. So I'm going to go ahead and start here by sharing and showing just a quick recording here. So, there we go. And let me know, this should have the audio in it too.
Hello and welcome to CU Anschutz College of Nursing. And in this guide, we're going to be covering some of the basic accessing of Canvas and some navigation and getting into your profile and settings. So you'll notice that we're starting here at CU Anschutz homepage. And up here in the upper right, we do have a series of quick links, a few of which we'll have to quickly describe as the webmail, as being something slightly different than a function that you'll find in Canvas. But keep in mind that from the homepage, here is where you can access your Microsoft webmail account. And that should be your first.last@cuanschutz.edu. And that'll be very useful for all sorts of communications. As we get into the Canvas, we'll notice that Canvas does have its own internal inbox, but just note early that it's different from your college, your university CU webmail. So with that said, let's go ahead and select Canvas from the quick links in the upper right. And here right off the bat, we're going to be given a login option. So this is where we are going to use our CU webmail address, the first.last@cuanschutz.edu, and the password that you have tagged to that for accessing all things CU Anschutz. And the first thing that we want to notice is as we log into what is called the dashboard. And I'll give you a quick rundown on the global navigation for Canvas. So you'll notice this column here on the left, and this is what's called the global navigation bar. And these options, these links will be the same and in the same order, no matter where you are in Canvas. Here we have our account, our dashboard, courses, calendar, inbox, and I believe you may or may not have comments, but you definitely will have the help option down here. Another thing to make note of is this main area here in the center. This is what we'll be calling your main content region. And then up here at the top, sometimes you'll have things here. It's got our title area for dashboard, but also sometimes it'll have your breadcrumbs wherever you go, kind of lets you know how you got to that certain point in a course. And then also here on the right side, occasionally we'll have things in the right sidebar. So in this case, we've entered Canvas to our dashboard, and this is kind of like our homepage hub. And then we also have up here in the right sidebar, our coming up, our recent feed, and then sometimes in courses we'll have a to-do list. So it's pretty good practice once you log in to take a little look over here on the right to make sure that there's nothing coming up that you're not expecting. So with that said, let's go ahead and take a look at our account. So this is where we're getting our pop-out, and we have some options here. So once again, this was our global navigation. So this little pop out is our local navigation. So in this case, it's our account navigation. When we get into our courses, it'll be our course navigation. So for our account, we have a series of options here, and we're really just going to focus on notifications, profile, and settings. So files is a place that any file that you upload will end up in here. That's just good to know for right now. ePortfolio is something that you can build, but it is kind of currently going through a transition with Canvas. So this is something that will be better for another guide. So let's take a look at notifications. Here in notifications, what you'll notice is we have a series of categories in our main content region. We have our course activities, we have our discussions, we have our conversations, our scheduling, and our groups. And so these are all notifications, things that we can adjust notifications for under each of those categories. If you want to, you can hover over any of these individual items and get a quick description of what it is. And then what you'll notice over here on the right is the email address. It's automatically populated with our CU email account. And so this is once again your first dot last. But in this case, this is my alternate one. So what you'll want to do is take a look through here, and we have a key across the top. These icons each are different degrees of immediacy of notification. Our check is to be notified right away. The clock icon is for daily reminders. The calendar is a weekly summary. And then the X is no notifications. So you might want to come through here and find things that would be especially useful to get a notification for. So for example, course activities, anytime the grade policy changes, this might be something good for this. I'm sure this probably won't be changed as regularly, so maybe like weekly. But when it comes to things like grading, you probably want to know immediately. Maybe same thing for invitations. And also maybe like late gradings. So you may or may not have a few different options than I do. This is my pseudo student account. So this is actually a teacher's account. But go through and look at each of these, and remember you can hover over each category and then determine whether or not you want to be notified right away or maybe later or not at all. So once you've selected these, there's no need to select any sort of save. You can move on to your next tab. So next we're going to look at profile. So in profile, this is our information about ourselves. And so like I mentioned before, sometimes there are things that come up in the right sidebar. So once we've navigated here, we notice that we have this edit profile button up here on the right. So let's go ahead and select this. You can come in and change our details. And if you have any links that you would like to link to, for example, if you have an ePortfolio that already exists that's external, you can link to that here. Or if you have like an academic website that you curate or maintain that you'd like to host as a part of your profile, definitely feel free to title it here and put the URL, the web address here on the right. And then of course, select Save Profile when you're ready. So this can be useful. Many courses, your instructor might ask for you to come in and make updates. Definitely one of the first ones too would be your profile picture. So you can do this without even selecting the edit profile by hovering over the icon image, clicking the pencil icon, and then selecting your photo that you would like to have as your profile picture. So I'm gonna go ahead and select this one, kind of adjust it and save it. And voila, new profile picture. So many instructors will ask for you to be sure to go in and update this. This is great for them to keep track of faces and names. And it's also useful in your first few weeks as you introduce yourself to other classmates. They may be able to observe your profile within that course. The next option, so we're going to skip over the files. I will briefly just go in here just to show you that since I uploaded my profile picture, that should be an item here within my file folder. So anything that you upload into any of your courses using Canvas will also end up here in your file folders. There should be drop downs for the classes that you're part of. So next, let's look at settings. This is where you can come in, and if you'd like to, you can add an extra email address. So if you're getting email from one account, you'd rather have all your emails centralized, have all your notifications going to your personal email rather than your school email. You can do that by selecting the plus email address option here. And then you'll type in that email address, and that'll filter all of your notifications. That'll actually give you another column back in your notifications area that you can change your preferences to. So let's go ahead and do that really quickly. And you would select register, and it'll ask for confirmation. And then you should also see it when you go back to your notifications. Here we go, we have a second column. So you can go in and tailor these to your likings. So if you would like to remove from one and put to the other, you can do that. So keep that in mind as an option here. Back in settings, you also have some other things that we can change here. You can change your time zone, the language. Definitely come over here on the right sidebar. Keep in mind that it's over here, and you'll select the pencil icon, edit settings, and this will allow you to go in and change your name, display name, any other personal aspects here. Keep in mind also the settings area does have a portion here at the bottom that allows you to change the high contrast UI. So if you do have difficulty viewing the difference between colors, the color contrast can be changed. And there are some other accessibility options here too. So just keep in mind that your options, your settings are tagged in from the account local navigation bar. So that's our account section. Next, let's take a look back at dashboard. So we already have seen dashboard before. This is where we initially landed, but also keep in mind that this is where your classes will populate. So once your instructors have published your courses, they will show up here. So if you don't see any right now, don't worry. It just means that your instructors have not published the course yet. Once they do, you will automatically have them start publishing or populating here. And what you can do is from here, you can either view it as these cards, which sometimes have these images, or you can select this vertical ellipse here at the top and switch to either list view or a recent activity. And so list, this shows you what kind of due dates you have coming up in each of your classes. And then recent activity shows you the kind of things that you've been doing lately. So I like the card view, but definitely play around with these different views as your courses get started and see which one you prefer. From the card view here, I can click into any of these courses. So I'm going to do the demo one because here I'm registered as a student. What we'll notice is it automatically went from the dashboard down to courses. So we are now inside a course. We have our global navigation here on the left, and we have our course navigation just inside from that. And keep in mind, so the global navigation will be the same no matter what course you're in. The course navigation may change depending on how your instructor decides to arrange their course. So in this course, we have home, modules, syllabus, and people. Other courses, we may have other options like quizzes. We might not have people. We most definitely would have grades as an option, but this is just a demo area here. And so there's no assessment, no real assessment in this one. So there was no purpose for having grades here, but just keep that in mind. Also remember that here in the classes too, sometimes you'll have options here in the right sidebar. And for this one, we have a course stream and we have a course calendar. This will be populated with a to-do list as our course has items. And then same thing for recent feedback. Let's take a look at another course, what another course might look like. So here's another example of a different course. And keep in mind, like was mentioned before, the course navigation is a little bit different here in this course than it was the first one we looked at. Also, keep in mind over here, this course does have some activities that are going on, so they do show up here in the to-do list. The next thing that we have, and speaking of to-do list, is our calendar. So in Canvas, we do have a calendar that gets populated with our course items. So in this case, what you'll want to do is you'll notice that we still have our global navigation. We have a couple options across the top. We have a small calendar here on the right sidebar, and an option for finding appointments. So this we'll get to it here in a little bit. And then we have our calendars. This is going to be important right over here, the calendars area. Once you have multiple classes, you'll have multiple options to either select or deselect those course offerings, the items within those courses. So keep in mind this area over here, if you get into your calendar and you see that there's nothing there, make sure that you have selected a course. You can also, for this one, it says test student. You can also create items for yourself. And that would be up here in the calendar options, the plus button, to create new event, allows you to come in and you can set reminders to yourself, different school activities or things that you might want to do that are beyond what's given in your course, or to do items for yourself. So that's also an option here. And we'll notice that here in this course, we already do have a couple items that are showing up. Anytime an instructor creates like a quiz or an assignment, it will automatically populate in the Canvas calendar too. And also instructors can offer online or virtual office hours or sign up for real office hours. And that would be under this find appointment button. So if an instructor tells you that they have office hours, be sure to come in here and look under appointments. What that'll do is you'll be able to choose which class that you're looking at, select submit, and voila, we have a whole slew of appointment opportunities here. It looks like one of them is already selected. I've already been here before and I've selected a chance. So I'm going to go in and show you how to come in and reserve your own, I guess, appointment. In this case, you select whatever time works best for you, and then you can make any comments to the instructor if you plan on being a little early or a little late, or if you have a certain document that you need to bring to their attention or anything you'd like. Type it in here, and then you'll select the reserve link. In this case, I've already signed up for something. So, and the teacher's only allowing us to have one opportunity, so I can reschedule if I need to. So I'm going to go ahead and reschedule because this works better for me. So that is our calendar feed. The next thing we have is our inbox. Here we go. And so the inbox is a place where we can communicate with other students and instructors directly through Canvas. This is definitely different than our CU webmail. This is a little bit limited because it won't allow us to send messages outside of Canvas. This is only for internal use. So if you are interested in creating a message directly to your instructor, it can be pretty handy because you don't have to leave Canvas and it can be very academically focused. You'd want to select this icon here, the compose a new message. You're going to select your course and then select who you're going to message. So in this case, I'm going to select the teacher. And then you can type out your subject and your message here. You can also make attachments. You can attach videos. If you'd like to record a video, you can also do that. And so that would involve allowing your camera. And you would eventually hit send. So that is how you access and how you compose using the inbox. Few last things here. The comments probably will not show up in your account. This is more for instructors, but you'll definitely have access to the help button. And so this one, I would definitely suggest if you have any difficulties to focus them towards the chat with Canvas support. So this is for students. The other option here, the CU Online, I was directed not to use this one as much. I think maybe the instructor chat with Canvas might be a little more helpful, or the Canvas support hotline. So just be sure that this, to remember that this is here. This is an option for you. Some other resources to keep in mind also are the OIT access through CU, so our CU Denver OIT, and that would be up here. I'll also provide a link here at the end. And what this has is a series of guides on Canvas. So these are very useful for getting started. Another option is Canvas Community. And so this is community.canvaslms.com. When you come in here, you can select the student option, and that'll bring you to another series of guides that are regularly updated by Canvas itself, including guides on using the student app. So the student app is a very useful tool. It does not completely replace the full application of Canvas or the computer version, but it can definitely do most all of the things that you'd be able to do on the computer as well. And also, if you'd like to, there are links for Google Play access to the Canvas student app and the Apple Store link to the student app. Be sure when you are looking for it that you do search for the Canvas student, because there is also a teacher version, and I believe there might be a parent version also. So this would be the one that you'd be interested in. So thank you once again for navigating here, and I hope you have a great start to your term.
Okay, so that was our video, and my apologies if you're paying attention to the calendar or the length of my hair on that. It's a little bit dated, but it's got all your basics for getting around Canvas. All of this content will also be accessible to you through the Canvas course that you have access to now. I believe that's the traditional 2021 cohort. And so within your content here, there is a link that gives you access to self-enroll into the online orientation course. And from there, here, let's see, it should be in the student success, just past it. From there, you'll have access to all of this wonderful content that will be helpful for any questions you have with online content, online readiness, learning online, things about Canvas, and then also any proctoring service or questions you might have about proctoring. So I know that's definitely of interest, and we'll be fielding some questions too. We do have an example, kind of a demo quiz here in this content that is utilizing the proctoring tool that we have access to here at CU. And we will be able to answer some questions. I know there's a lot of concern about camera use in proctoring, and the tool that we have that's available is one that faculty can adjust, and it's kind of gives you a nice experience here in this content where you can go in and kind of get familiar with it and know what to expect if you do have a course that is proctored. And let's see. Beyond that, there is also a section in here that we're covering a little bit on netiquette. And so that's just kind of good to know. This tags into Zoom etiquette as well. And as many of you are probably well aware of, since kind of the turn for things going remote, Zoom etiquette has become quite a big thing. So we have just a couple basic tips here and some information on what you can do to navigate Zoom if you're not as familiar. such as your audio mute button here and your video mute button over here, as well as the ability to do reactions and chatting while you're in Zoom meetings. And this is just a nice little kind of rundown list of a few things to keep in mind while taking part in classes that are offered through Zoom, and kind of what's considered basic Zoom etiquette at that time, but also be aware that that really depends on which course you're in and kind of your own class etiquette and whatever your, other students and faculty are choosing to do with Zoom. So that's kind of a quick rundown of some of our content here. And just remember that there's plenty more here, and you can have access to this through your 2021 cohort Canvas course. And this will be available to you as long as you need it. And so with that, let's see. Are there any questions involving Canvas or online proctoring? Or actually, yeah, I'll have to take a peek here in the chat real quick.
I have a question.
Mm-hmm.
When you're looking at the, I forget which navigation page, not the course or the global, but the other one, and you see your assignments and tasks, is there a way to view it so you see what you have outstanding, or is it always just everything is loaded, current to do as well as completed assignments?
I think so. Here, let's show this version. I do have a test student that I can show you. And pretty much, this is a more realistic look of what it'll look like for your access point. In this case, you do have kind of a coming up section here, and this is more your global updates. But if you are interested course by course, just going into the course, you can access, let's see what might be a good one. You can kind of access your to-do over here, as well as the course stream would probably be a great tool for individual classes, because this will give you not only your assignments, but if you are in a course where you're using either peer review or like group activities, that'll show you here in this drop-down area what kind of things are coming up or what's due, or if you're assigned something to peer review. Does that kind of answer your question?
I think so. I guess with the stuff that we've been working on, it has all the information just right at the front. And when you do something, it still shows up. And I think just mentally, you're like, do I still have to do this? So you keep revisiting it. So I'm trying to figure out a way where I can like clean up that visibility, I guess. But
okay, yeah. I think anything in here in this might depend on your instructors, how they schedule the items into their course. But it should, once it's reached its due date, it should be removed from your list. I don't know if it doesn't have a due date, if it'll just stay on the list, but I can definitely look into that. And I think you should have the ability here to ignore it, to exit out.
oh, I see that. Thank you.
So if you're in the course stream, oh, sorry, the course stream, that's this option that will give you that opportunity. I think some courses, the instructor will set the homepage as the course stream. And I'm not sure if in those cases, if you'll be able to remove anything that shows up here. But yeah, that's a really useful function for figuring out what's due, what's coming up, and what you've already done. Let's see. Any other questions? And I'll scan the chat here.
Hi, can I make a comment about her question?
Mhm.
Comment in general. Hi, everybody. I'm Kelly Henricks. I'm one of the assistant professors here at the college, and I teach in the undergraduate program. I would normally be having you guys this fall in your nursing care of the older adult course, but I have a baby due in August. If you can see my belly, so I will not be meeting any of you, which makes me sad. Maybe in the course of your tenure here at CU. But I just wanted to make a comment from an instructor point of view about the Canvas taskbar. It's great, but I also just urge you guys to consult your syllabus for due dates. A great example of Canvas, I don't want to say misleading you, but for instance, if I have like an online discussion and I have you guys you have to make 2 posts in an online discussion, and one is due on Wednesday and one is due on Sunday. Canvas is set up such that I can only make it due for Sunday. So all you guys are going to see on that taskbar is that you have a discussion post due in your Care of the Older Adult course on Sunday. And I've had students miss that first Wednesday post because of that. So I think that, 95% of the time that function in Canvas is great, but I also would just urge you guys to really consult your syllabus for anything more detailed, things like discussions and such, because I just don't want you guys to miss due dates or miss assignments. And, I know it's not purposeful, but it's just that, I think a lot of people rely really, really heavily on Canvas, and sometimes it can be a little misleading. That's all. And I also, as a faculty member, have used the Proctorio function in my course quite a bit. So that's why Amy had asked me to kind of come in with Ryan if there's any questions about Proctorio from like a faculty standpoint. I am happy to try to help you guys navigate through that.
Thanks so much, Kelly. There are a couple questions in the chat, if you can see that, or Ryan, one of the 2 of you.
Yeah. Here, I can hop on and answer this first one. So the question is, are remote exams with Proctorio our only option for test taking? No, I mean, it's really depends on your instructor. There are a wide variety of test options, and Proctorio is one proctoring option that some faculty choose to use, but it's not mandatory. It depends on your course. Let's see, as for having it on your computer, this is kind of plays into a following question. There is an extension that you do need to download to use Proctorio, and that extension allows you as a student to contact and chat with Proctorio support if you need it. The extension doesn't need to be on your computer all times, and doesn't need to be active on your computer at all times, but definitely does need to be on your computer when you're testing. So if you're not comfortable with having it, you can always remove it from your extension list when you're not testing, and then just download it during then, or even just turn it off from your extensions. Or other options are possibly, finding quiet spaces like in Strauss Library, where you can do test taking and then use a computer that's, through CU systems. So that's another option there. Let's see, the question about accessing your online activity with Proctorio. This also plays into the Proctorio settings. So if you are in a course that has an online proctored exam with Proctorio, your instructor will have the choice to kind of decide how strict or how lenient the settings for Proctorio are. And these settings are really kind of red flags for your instructor. And that information does not get outside of your instructor's eyes. So there is a lot of security in the information that's being utilized with Proctorio. And then also there's a lot of, ability for instructors to adjust that, to be more lenient as they need. So if that's a concern, definitely, talk to your instructors about it. If you have an instructor that's using Proctorio, you can always ask them if you have concerns.
And related to that, Molly, the settings, I do use one that says block the student from opening other tabs. So for obvious reasons, while you're taking a test in my course, let's say it's a 75-minute test, if you tried to open up another window, you wouldn't be able to, Google an answer for something, obviously, or look up, an answer. So just during that time when Proctorio is monitoring you, yes, you're going to have to close all tabs except for Proctorio because you can't even get to the exam until you do that. And then while you're taking the exam, you won't be able to open any new tabs. So getting, accidentally flagged for cheating with the open tabs, you won't even have an option to do that. I would say that the things that most commonly happen that, Proctorio, it's not a live person. It's basically just a software that's videotaping you and audio taping you. When I review the flags, like silly things like a cat meowing. So it hears that audio and it might flag you. And then obviously the instructor just has to vet these flags, and she or he will, obviously not say, oh, this person was cheating, there's a bunch of audio. I had a student who had fire alarms going off during one of his exams, the poor guy. I would just say that, when you're going to take an exam, I think Ryan's point about going to a quiet place or going to the library is a great idea. If you are in an area with a lot of noise or a lot of distractions, you are going to get flagged because you might be moving your head toward this distractions. There might be different audio things going on in the other room. So just really be conscious of that and try to set aside a really quiet, intentional space to take an exam if you know the instructor is going to be using Proctorio. Just kind of reading through the comments here in the chat.
Just to hop on one of these, there's the question, will we be given instructions on how to download Proctorio and how to use it? And definitely yes. So one of the self-enroll online success modules, there's instructions on how to get Proctorio and even like a test quiz. And the quiz is really simple. It's just silly things like it's going to quiz you just a couple questions on getting around Canvas and some of the stuff that we went over here today. But I would definitely suggest take the time, go in there, make sure that you're able to download the extension into your browser and then do the practice quiz. And even if you're worried, like before an actual quiz, you can do this anytime beforehand, but definitely suggest to do this before you get to an actual proctored quiz in any of your courses, because this way you'll be able to be a little more comfortable using it. And if anything does come up, you'll have that time to kind of address it. And kind of on that note, one of the biggest things that I've seen is students trying to access a proctored exam without the extension. And that'll definitely give you some little error messages, and it'll make it sound like you need to type in like an entry code. And that's just a really big tip off that the extension hasn't been downloaded. So that's one of the easiest solutions there, is just kind of going ahead of time into the content that's here, that you have the practice test on, and just try it out there and make sure it's working fine.
I highly agree with what Ryan just said. Back to the, do we have to use Chrome for Factorio? Yes, because the extension is added onto Chrome, so you do need to use it. But as Ryan said, if you're not comfortable having it on your computer all the time, you can be taking, adding it and removing it. It is super easy to add the extension and remove the extension. And will all our exams, Kathy asked, will all our exams be online this semester? That's completely up to your individual faculty that's teaching the course. If he or she wants to use it, that's their prerogative. I can't speak for any of the other faculty. It is a nice way to ensure, if you want it to be a closed note exam, it's really, unfortunately, this, without having you guys face to face this summer, that is the only way, to ensure that the playing field is even and that everybody is, following the rules, so to speak. And but I don't know the answer to that. Once you download the extension, do you have to do anything to get Proctorio to pop up before you test, or just by getting it on the exam, it will start on its own? I believe so. And as Ryan said, the big red flag, if it's not installed correctly or not installed, period, is that when you try to get in the exam, it's going to ask you for an access code. I've gotten multiple emails from tens of students. Why is it asking me for an access code? That means that something's wrong with your extension, because the exams will never have an access code attached to them, okay? Do we currently have access to the practice test? Yes, they do, right? You have access to the practice test. So take it, familiarize yourself. And then again, just know, as Ryan said, that the individual instructor has options how strict to make the settings. So for instance, I can look at the behavioral settings, such as your eye movement. So I can make it like really lenient, so you can move your eyes and like look up to be thinking about an answer, or I can make it really strict that every time you guys look up to think about something, it flags you. Like maybe you have notes on your ceiling or something. Obviously not, but that's just what the software does. It's not smart enough to know whether it's legit or not. But the individual instructor can kind of walk you through what he or she is looking for in terms of those settings, and in terms of flags that might worry him or her about you potentially having notes or something like that. Will an ad blocker extension on Chrome interfere with Proctorio, or will it require disabling all other extensions before entering an exam? Do you know the answer to that, Ryan? I'm not sure about that. I've never had that asked.
Oh, sorry, which one was this again?
The one about an ad blocker extension.
Oh, yes. I don't think the ad blocker will interfere, but if you are using an incognito tab, you'll probably get a message from Proctorio, because incognito doesn't allow extensions. So just make sure as you're taking your exam that you're not using an incognito window. It'll definitely pick up on that. And for an earlier question here, there was a question for if you can limit access to the extension, and yes, you can. So there's once you've downloaded the extension, if you go into your extension settings, and then you can click the vertical ellipse next to Proctorio, and there's the option that it says this can read and change site data, and you can change that to only when you click on the extension. So that gives you the opportunity to manually turn it on and off. And that also plays into some of the questions earlier, is how do you know that it's working? It'll turn into a shield, and the shield will change colors when you're on an exam that has Proctorio. And also when you hover over or select it, it'll give you the option for chat with Proctorio, versus if it's not active, it'll give you the extension options to manage the extension. So those are some quick indicators.
There was a question about your IDs. You don't have to use the same ID for any Proctorio exam in a course that you use for the practice ID. Sometimes if your ID if it's an old picture, doesn't really look like you, it might flag the instructor that, it might say, like, to me, it might think that it's another person trying to take your exam, but all I need to do is look at the flag, and I see the ID with the name, and I know it's you. So it's not a big deal. Because Hannah asked my camera on my laptop is not the best. I had a hard time getting a clear image of my ID. Just do the best you can. I would probably email, if you know your instructor is going to be using Proctorio this summer, I would probably email him or her to just let them know that right from the beginning, because you might get flagged, but then at least your instructor is going to kind of expect that and know that you've already reached out to him or her about it.
Oh, oops. I think I accidentally gave you a link to the Zoom etiquette file. Here, I was gonna type in the chat here a link to the online orientation course.
The other thing that I would say is a common issue as a faculty member that I'm going to mention is, like, let's say you're in the middle of an exam and your internet goes down, or you lose computer on your laptop and you don't have your cord with you to charge it. The only, the way Proctorio is set up is such that the instructor cannot, like, I as the instructor, you can email me and let me know what happened, but I cannot give you another attempt at the exam. The only person who can do that is the live, you have to do the live chat with one of the Proctorio folks. They are available 24/7. So as Ryan said, once you have the extension enabled, there's a little icon to start a live chat. And once you get your computer back up or the internet's back up, they're the people that are gonna have to give you another attempt to get you back into the exam. So just, you know, if it's 2 in the morning and you're not gonna be able to get a hold of your instructor, they're your best, you know, and it's due by 8 a.m. or something and you're freaking out, really that 24/7 Proctorio live chat is your best option. I'm just trying to think of like other common issues I've seen as an instructor.
Mm-hmm. Yeah, and that kind of tags in with the Canvas support that was mentioned in the video earlier. Is a lot of times your best first go-to is going to be your instructor. If it's a Canvas issue, your next best go-to is the Canvas specific support in the help button on the left. And then if it's a Proctorio issue, then using the extension button itself will get you the ability to chat with support there. And then as a side note, OIT is really great for all of your general tech support questions. Let's see, anything else?
Yeah, did we miss anything in the chat? Any questions that we missed, guys?
I think we're set. Thank you so much, Ryan, and thank you, Kelly, for being with us this afternoon.
Welcome.
Yeah, thank you.
Welcome, everybody. Good luck to you all. I hope to meet you at some point.
Mm-hmm. Hope you have an excellent experience.
So I'll go ahead and shift gears. We were able to have our last presenters join us a little bit early, so I just want to take a moment and introduce Daniel Mark, who is our Deputy Chief of Police, as well as Gary Martinez, who is our Emergency Management Director at CU Anschutz. So I will let Dan and Gary take it away. Thank you two so much for being here this afternoon.
Certainly, thanks for inviting us. I am going to attempt to share my screen here if I can get this figured out. Okay, I'm hoping you all can see the slideshow presentation.
Yes.
Okay. All right, well, as Amy said, I'm Dan Mark. I'm the Deputy Chief of Police for the CU Anschutz Police Department. And Gray Martinez is the Emergency Management Manager for CU Anschutz, and also has some responsibilities at CU Denver campus. So Gray, I'll let you chime in with anything additional you want to bring up.
Thank you very much, and thank you all, and welcome to the University of Colorado Anschutz Medical Campus. I am excited for
journey. Like Deputy Chief Mark mentioned, I am the Emergency Management Program Manager. I have a cohort that I work with. We split services between the Anschutz Medical Campus and the Denver campus, and we are here to help you with all your emergency preparedness, protection, and prevention needs.
Great, thanks. All right, well, I'll start off and we'll just kind of tag team it in. Unfortunately, at least on my end, you've kind of got the B team. There's a sergeant and a detective that normally handle this, and they are both tied up today. So you're stuck with me, and I'll get through it as best I can. I'm familiar with the information at least. All right, as long as I can get my PowerPoint to work again. There we go. All right, so Chief Rapola is our Chief of Police, and like I said, I'm the Deputy Chief. And I'll go over just our different areas within the police department. We have 4 different divisions. A law enforcement division that our primary responsibilities are patrol. We also have security officers. So the police department's broken down into police officers, and they're fully commissioned police officers. And then we also have non-commissioned security officers. So those are unarmed security. They help a lot with things like being locked out of offices, escorts, particularly at night, that kind of thing. Then we have a full investigative unit and a community resource unit. We also have our emergency communications and record section. We have our own dispatch center on campus, our own record section on campus, property and evidence. We do emergency notifications through them, and then I'll explain a little bit about the Clery Act later. And then emergency management, which Greg will talk about in a little bit, and then electronic security, which deals with the badging for the campus. There's an extensive security camera system around campus, an alarm system, and then electronic access to buildings, offices, and also to the parking lots. It's kind of unusual here that we don't control parking within the police department. That's done by facilities. So all of the enforcement and everything is done through facilities. All right, I already mentioned the law enforcement division. We're staffed 24/7. Our authorized strength are 29 officers and then 6 security officers. We're unfortunately rarely at authorized strength. We're typically 2 or 3 positions down at any given time. Trying to hire police officers and security officers can sometimes be a little bit of a daunting task. So, but we're working on trying to get up to full strength. We're responsible for taking police reports, investigating any crime that occurs on campus. We kind of have a partnership with the Aurora Police Department in that they have a district station here on campus, and they primarily respond internally to University Hospital and Children's Hospital, and then we have primary responsibility for all the buildings and everything outside of the interior of the hospitals.
So my division, the Emergency Management Division, is staffed by skilled professionals who plan and prepare for a variety of types of emergency incidents which may occur on or around campus. We work together with other offices and members of the university and campus community to successfully prepare for and respond to a variety of emergencies. Some of these emergencies may include fires, floods, severe weather, active harmer situations, hazardous materials, civil unrest, and a variety of emergencies that may impact the campus community. In addition to that, we also do a lot of emergency planning and preparedness, community outreach, and training and preparation to various stakeholders in and around campus.
The electronic security division, like I mentioned earlier, they are responsible for all of the badging. So your badge that you wear around campus, getting you in and out of buildings. If you have any problems with those, they have a badging office that'll take care of that for you. We also have, like I mentioned before, an extensive security camera system. So most of the campus is covered by security cameras. We don't, we don't actively monitor them as far as, watching every camera all the time. There are just too many of them. But what we do is when an alarm comes up, then the dispatchers can go immediately to the camera that covers that area where an alarm has been activated. We have a full-time communications and records section. So our police department runs their own dispatch center. So one thing that's important to know, and we'll get into this a little bit later in the presentation, but I always like to really emphasize the fact that if you're on campus and you dial 911 on your cell phone, it will route to the nearest public safety communications dispatch center that's not ours. So it'll most likely route to Aurora. It could route to Denver. It just kind of depends on which cell tower picks up your signal. And then what happens is the Aurora Police Department then transfers it to our dispatch center if it's something that's going on campus. So I really want to emphasize that it's a good thing to put the 303-724-4444 number in your cell phone and just label it CU Police or something like that, because that'll be quicker as far as getting you an emergency response. And then we also have an app that we'll talk about in a little bit that's even easier. But I just like to really emphasize the point that if you're on campus and you dial 911, the cell carrier will route it to most likely Aurora Police. And we have a very close relationship with them. So it's, they will transfer it directly to us, but it's a delay that's really unnecessary. And this slide just emphasizes the fact that you want to dial us directly and not 911. So you can dial that 724-4444 number is good for emergencies and non-emergency situations. So if you can't get your car started, we will come and assist you with that. One of our security officers will come. If you can't get in a door that you need to get into, we'll come and take care of that for you. If we have a safe ride program, so if you're here studying late at night and you don't feel comfortable walking to your car in a parking lot, we will certainly provide you with an escort. Now, what we won't do, and I kind of have to emphasize this because we had some people that were taking advantage of it in the form of like an Uber ride, and we really want to just maintain it for situations where you don't feel safe. If it just happens to be drizzling or something and you don't want to walk from the car to the classroom, that's not what what it's intended for. So we'll also assist you with if you get stuck in one of the parking lots that are gated after hours and you can't get out, then it doesn't happen very often, but it's occasional. We'll help you with that also.
So CU Alerts is the system. This is how we get in contact with you when there's an emergent threat happening. These alerts will keep you informed and up to date when important information is happening around and on campus. This is the fastest way to receive CU Anschutz alerts during a threat. And the best way to do it is to sign up through your cell phone today using the text message system. So the first thing that you want to do is text CU Anschutz alerts to the 6-digit code 226787 and then hit send. It'll automatically generate into our system to make sure that you receive those alerts. Another way to ensure that you receive these alerts is go into your CU portal. Under your CU portal, in your personal information, you'll update your cell phone number. Having the correct cell phone number in there will ensure that you get these messages. Because this is the primary way that we send out alerts to campus constituents, multiple stakeholders across campus, whether that's the Veterans Hospital, UC Health, At Children's Hospital, they all subscribe to this UC Health system. So no matter where you are on campus, this is the best way to get those alerts. Now, this next slide talks about Safe Zone. The CU Anschutz Police Department utilizes the Safe Zone app as a personal well-being tool to ensure your safety and help provide some security while you're on the Anschutz Medical Campus. The Safeguard is the quickest way for you to send emergency information to the police dispatch. So they have 3 icons on there. There's medical. You click that if you're having a medical emergency. You can dial for alert information. This goes to our automated system, which will provide any campus closure information, any delays, anything like that. And then if you are under duress or currently experiencing an emergency, you can hit the emergency button. It'll go straight to the CU Anschutz Police dispatch line. You can also log in. This is great. Say if you are coming from one of the buildings on campus and you're walking to your car and it's late at night and you feel unsafe walking by yourself, you can log into this app and we can track where you're going until you get to your car, and you can set a timer on there saying that I have a 15-minute check-in window. And if I do not check in on my app within 15 minutes, the police dispatch will be notified to go and find you based on that location, that pinpoint of where you are using the app. Deputy Chief Mark, could you please press the play button? So it looks like the sound is not connected for this. So Amy, I'd be happy to send this over to you if you'd like later on.
Sure, that would be great if you could do that.
No cost to them. If you need first aid or just want to let someone know where you are on campus, SafeZone connects you directly with the CU Anschutz Police Department. Using the app provides a faster response time than calling 911 from your cell phone. Download SafeZone and log on using your university credentials. The main features on the screen include medical, alert info, and emergency. The green medical button is a direct call to the City of Aurora's emergency medical service and also notifies the CU Anschutz Police Dispatch. The blue alert info button calls the CU Anschutz information line, where you can hear updated information about the status of the campus during severe weather or other emergencies. The large red emergency button will connect you directly to the CU Anschutz Police Dispatch and will automatically send them your campus location. When this button is used off campus, 911 will be called. If you ever press these buttons accidentally, don't worry, just cancel the call. At the top of the screen, there's a handy check-in button to let campus security know your location on campus. This feature is useful when walking to your car late at night or if you're working alone in a hazardous area like a laboratory or confined space. Your location on campus will never be accessed by security unless they are alerted or you need to make them aware of something. In the settings menu, you can configure SafeZone to automatically check you in and out when you arrive or leave campus. Once checked in, the app displays what building you are in when you are on campus. Make sure you have Bluetooth turned on for the most accurate positioning possible. And rest assured, your location will not be known beyond these boundaries. SafeZone is monitored by the CU Police Department Communication Centers 24 hours a day, 7 days a week. When alerted, the communication center staff will then try to contact the person requesting assistance and ascertain the nature of the emergency. Police officers will be sent to assist if needed. You probably won't need to use it, but if so, rest assured it's on your device if needed.
Once I figured out that when I'm on mute, it won't play the sound, I guess it works a lot better. Sorry about that.
So the next slide discusses additional campus classroom safety. So you find these emergency response guides placed throughout all CU Anschutz buildings. These guides provide general information for emergency situations such as fire, an active harmer situation, bomb threat, inclement weather, medical emergencies, hazardous materials, or say suspicious activity or concerning behavior that may arise on campus. There's also a QR code that's been provided at the top of this at the top of that page, which you can download onto your phone and bookmarks for quick reference. The classroom security project, which is discussing the stuff on the other side of the screen, was that stuff was developed for populated spaces on campus with additional security features to include like panic buttons to the alarm and campus police, strobe lights indicating that there's an emergency inside the building, electric door locks providing safety to those inside restricted areas and providing access to someone from not restricting access from others entering the room during a lockdown event. The windows have also been enhanced with reinforced glass and opaque window film and stop the bleed kits. In the event of an immediate threat, it's important that you follow these steps. You want to push the emergency panic button, contact the University Police Department at 303-724-4444. And then after that's done, evaluate your safety options. Thank you.
Okay, and just, I'm going to go back one slide. I want to make a point of the fact that these bleed kits, they're alarmed, and not so that people won't steal things out of them, but so that we'll be notified if one of them is open. So we always tell people, if you're looking for a Band-Aid or some aspirin or something like that, please don't open them because a police officer will respond. We have them alarmed to our dispatch center so that in the event of a medical emergency, we'll be immediately notified when someone opens one of those up so that we can get officers there and then also get paramedics started.
And if I may,
go ahead.
With our AED kits, I apologize. We do the same thing with our AED. So if somebody is experiencing like cardiac arrest, we also have them set to alert our dispatch department so an officer can respond as well.
Yeah, good point. Great, thanks. We'll kind of wrap things up with just a brief explanation about the Clery Act. It's unique to campus policing in that there are federal law requirements that we make campus notifications. So, and we'll make those notifications through the CU alerts. There are also pop-ups that'll come up in email. But anytime there's any type of an emergency on campus, you will be alerted. And there's also a requirement that we produce our annual security, fire, and safety report. And that'll have all of our crime statistics in it. I can tell you that I've only been on the campus here for a little over 2 years, but I've got 35 years in law enforcement. And the security and safety of the students, faculty, and staff on campus that's our number one priority in the police department. And we honestly have a very low crime rate on the campus. So if you access this, and you can access it on we have it posted on our website. If you just Google CU Anschutz Police, you'll be able to find it. And you'll see the crime stats for the last few years, and they're very low. But we're very diligent in trying to keep crime down on campus. Most of what we have are property-related crimes that happen throughout the metro area, auto thefts, bike thefts, that kind of thing. But the Clery Act really drives what we have to send out reports on, and then the emergency notifications, even if it's something that may have happened an hour earlier. We may just send information out just to keep people updated on it. So there's emergency notifications and timely warnings. The emergency notifications are things that are immediate and that are affecting the safety of individuals on campus right at that moment. The timely warnings are things that may have occurred earlier, like within the last day, let's say, and we're just being made aware of it. So we'll send information out about things that are going on around campus. And the Clery Act mandates that it's not just on campus proper, but within a radius of campus. Some additional resources, just phone numbers for University Hospital, Children's Hospital. I'm sure most of you are aware we have Veterans Hospital on campus also. And then the Aurora Police Department, like I mentioned earlier, they have a district station on campus. We have a lot of police presence on campus between University Police and Aurora Police. All right, that ends our presentation, and I'd certainly be happy to answer any questions that anyone has.
Sir, I have a question.
Sure.
So other than the fact that, you know, we operate under run, hide, fight protocol, if there's an active harmer situation, what type of tactical response, if any, are we allowed to, like as individuals, are we allowed to respond with?
Well, that's kind of a tough question. You know, it depends on the individual. I mean, we actually do active harmer presentations throughout the year. So, you know, we'd be happy to do one for you all at any time. We typically try to do them quarterly. With COVID, it's kind of like with everything. It's made it a little tougher. We have done some virtually. I'm hoping that we're going to be able to start doing them in person again. But really, the whole response to an active harmer on campus, you know, all of our officers are very highly trained, and then of course we have all the resources of Aurora PD. But it's really situational as far as what you should do, and I really do believe in the run, hide, fight aspect of it, that, you know, the first thing you should try to do is just get out of there any way that you can. And then if you can't escape, then hiding is the next best option, and fighting back is kind of the final option. But as far as that fighting back part goes, it's really up to whatever you are comfortable with. You know, that's kind of the best answer I can give you. It's very situational.
Okay, thank you.
Certainly.
I would also like to add, one of the most critical points in run, hide, fight is having a plan in place ahead of time. It's taking the time before an event happens, but know where your paths of exit are, where a hiding spot would be, and not just one, but multiple places. Because in the unlikely event that it does happen, we can't guarantee that, say, your office, the one that you normally go to, or your classroom or area that you usually work in, is going to be available, because an incident can arise in any spot anytime. So having multiple places to prepare. When you talk about what your capabilities are to protect yourself, that all goes to what you are comfortable with. Like Chief Mark said, don't do anything that you are not comfortable with. So follow that protocol of run, hide, and as a last resort, fight. But if you do fight, commit to your actions, and also work as a team when possible. Working as a team will help subdue the assailant much easier than working on your own.
So Gary, Gary and Dan, I just want to let you know that there's a student wrote in the chat that she was trying to add the safe zone, and it said there weren't any safe zones available for her school email address. Is there something confusing, or maybe I'm not sure how to direct her?
Yeah. You know, great. It's probably best if we check. It may be a matter of an issue with her email address, because I know we've had that problem before, where if there's a a problem with the email, that it doesn't recognize it. And you know, one other thing I'll bring up, and I see in the chat that someone else is having that problem too. You know, one other thing I'll bring up is, and I probably, well, I should have notified our dispatch that we were doing this class because inevitably we'll have someone hit the emergency button while they're configuring the app. So I'll, as soon as we're done here, I'll give them a call and let them know. But it's, Greg, do you want to maybe put your email address in the chat, and then if they are having problems, if they can email you?
That's exactly what I was going to recommend. Thank you so much. So I'm going to put my email address in, and then my colleague Tyler Belgamont's email address in there. That way we can work together on making sure if you do have any issues, we can address them.
Perfect. Thank you so much. And I'm also recording this session so the students can refer back to it in the future as well.
Perfect. Hey, one last thing about that app that I can tell you just from a personal standpoint. When I first got on campus, I was routinely lost, which isn't good for the cops to be lost on campus. There's a mapping app, or a mapping component to that app up in the upper right-hand corner that's just phenomenal. It'll help you get around campus. So that's also a good thing in a non-emergency situation to be able to do. All right, if there are no other questions, I know we took longer than we were allotted, sorry, but.
No, it all worked out. And thank you for your flexibility with joining us a little bit early. We did, it looks like, have one final question. One of our students lives with a couple of nurses on campus. Are they eligible to be part of that Safe Zone app? It looks like Gary just answered. Perfect. Thank you. Awesome. Well, thank you too again for your time.
Certainly. Thank you all, and welcome to campus.
Thank you.
And so I'll just, I'm gonna stop the recording here in just a moment, but I just want to mention to students, somebody had asked me during one of the breaks about parking passes. And so since you all are going to be remote this summer, you know, with very few exceptions, I would say just pay for your parking on campus hourly while you're here. And the parking is $1 an hour. And there are a number of lots where you can park by the hour. For the full day, it's $8 to park. And then as we get closer to the fall, when you're going to be on campus more, you'll be provided with information about setting up your parking pass that you could, it's a monthly pass that's attached to your badge that you'll be able to access the lots. So we'll cover all that as we get closer to that fall period of time. So I'm going to go ahead and stop the recording now.